Recording in progress.
All right, good afternoon, everybody. We'll call together the Protection Policy Committee for Monday, June 19th, 2003. It is now 5:01. Roll call, Alder Scannell.
Present.
Alder Morgan.
Present.
Alder Grant.
Present.
Alder Stevens, I'm here as well. All present. We'll move on to the approval of the agenda.
I'd like to amend the agenda. I'd like to put items 2, 3, and 6 through 13 at the top of the agenda.
Okay. Do we have a second?
Second.
All in favor?
Aye.
Nay? Ayes have it. Do
Motion to approve the agenda as amended.
we have a second?
Second.
All in favor?
Aye.
Nays? All right, ayes have it. On to approval of the minutes for May 22nd, 2023.
I approve those minutes.
Do we have a second?
Second.
All in favor?
Aye.
Nays? All right, ayes have it. So we're moving items number 2 and number 3.
Motion to suspend the rules.
All right, do we have a second?
Second.
All in favor?
Aye.
Aye. Okay. Do we have a motion?
Motion to approve items 2 and 3.
Do we have a second?
Second.
All in favor?
Aye.
Nays? Ayes have it. Okay.
Motion
Items-
to suspend the rules for items 6 through 13.
Do we have a second?
Second.
All in favor?
Aye. Motion to approve items 6 through 13.
Do I have a second?
Second.
All in favor?
Aye.
Nays? Ayes
Alder
have it.
Stevens, does that include the first and bold?
No, that's number 5, Alder Johnson. Sorry, we
We
separated that
excluded
one.
that.
Yeah, we,
Okay,
Yep.
thank you, just wanted to be sure.
No problem.
all set over there?
Yep.
Okay, on to the item number 4, consideration of possible action on renewal applications for the 2023-2024 license year with no changes, subject to approval of the proper authorities. Do I have approval?
Motion to
Do I
approve.
have a second?
Second.
All in favor? Nays? Ayes have it.
We'll go back to that. We moved the rest in front of it.
All right, number 5, consideration of possible action on renewal application for the 2023-2024 license year for Football LLC at 301 North Washington Street. Attorney?
Wait, Alder Stevens, did we move that one to the top of the agenda? That's not one of the ones we moved.
4 and 5, yeah, we didn't move 4 and
We
5.
didn't move 4 and 5.
So just go back to
So
one.
those have to wait.
Oh, all
We're
right.
on number 1.
Number
Yeah,
1.
no,
All right.
yeah.
Well, those will go quick.
Yeah, I didn't know. I thought, okay.
All right, on to number 1, a presentation by Linda Van Thiel, Blueprint,
Thank you.
yeah, thank you, Project Director of Greater Green Bay Blueprint to prevent and end homelessness.
Hi,
Hi.
thank you very much.
Does she need to state her name?
Yes, you need your name and your address for the record.
Name is Lydia Van Peel. Address is 2058 East Vista Circle, De Pere, 54115.
Okay.
Thank you very much for having me today. I just wanted to come and present an update on where we're at with the Greater Green Bay Blueprint to prevent and end homelessness. This project has been going on for about a year now. I've been in the role as implementation director for about 10 months. The blueprint came out in fall of 2021, so it's been over a year and a half at this point. And so I just wanted to come and present an update of where we're at with progress with the blueprint and where we are, where we're moving forward on some things. So the blueprint is broken into 5 different strategies. The first one is about increasing access to affordable housing options. So all of the tasks that are outlined in this update are specific tasks that are in the blueprint to prevent and end homelessness, and there are shy of about 100 tasks. So we're definitely moving forward on some of the work. The first is that in the fall of this year, Journey to Adult Success, or JAS, Jazz House, is currently in process of a capital growth project to triple their capacity, specifically for youth aging out of foster care, which addresses one of the tasks in the blueprint. We're also working on building up landlord engagement in this community between the Brown County Housing and Homeless Coalition and Apartment Association of Northeast Wisconsin. Several landlords are participating in the coalition and participating in a few of the committees that we have at the coalition as well. We also, the Brown County Housing Authority and ICS created a landlord incentive program this year that is in operation from January to December of this year or until funds run out. And that is a designed to increase engagement with landlords in this community to accept people that have housing assistance vouchers. So that is something we've been working on for the last few months, is really working on engaging with landlords in this community and continuing to work through those relationships. In May of last year, we had Foundation Raise Youth Services also expanded into Brown County to open up some host home opportunities for youth. We can move to the next slide for strategy 2, increase access to and coordination of services. So this strategy is largely just about coordinating services throughout the homeless providers and engaging with people experiencing homelessness. So a lot has happened in this space in terms of increasing our outreach and navigation services that we have. Behavioral, in spring of last year, the Brown County Health and Human Services hired a homeless outreach social worker to be on the streets working with people experiencing homelessness and engaging them in behavioral health services. In fall of last year, House of Hope began operating a youth homeless demonstration program grant in which they're working with youth experiencing homelessness, engaging with them on the streets, and connecting them to resources throughout the community. And then we also are working on engaging and increasing street outreach in the community as well. So NewCap hired a homeless outreach staff that specifically oversees our homeless outreach team through the Homeless and Housing Coalition. And they're also operating a PATH grant that will build connection and services for people that are on the streets with disabilities and mental health issues. And strategy 3 is all about employers and educators being part of the solution. So with this one, in January of last year, the Division of Workforce Development created a pilot program called Worker Connection. They came into Brown County and began working with shelters as well as the Brown County Library to connect people to work, and about 30% of the people that they're working with are experiencing homelessness, so that's a great deal of the population that they're trying to serve and engage with. December of last year, NeighborWorks created a Great Being Home program, which is a down payment assistance program that partners with employers to provide financial assistance to people in buying homes. So just trying to make connections with employers in the community to help them be part of the solution and addressing the housing issue that we have. In winter and spring of this year, there was a series of youth services conversations that were organized by Brown County Children, Youth, and Families. And they really worked to develop a broad understanding of what youth services programs were in Brown County and created some connections and connected them into the Homeless and Housing Coalition to be part of that larger system of care. And strategy 4 is all related to preventing homelessness, or doing upstream prevention, supporting employment, and decreasing criminal justice involvement. Last fall, the Brown County United Way Community Service Agency and Family Child Care Resources of NEW worked together to develop a culturally inclusive child care provider training to Somali women, and they're looking to continue to expand that, currently partnering with Casa Alba and looking to expand that into other cultures and languages. So looking to continue to work on and build that in this community. And then in this summer, we are Brown County Homeless and Housing Coalition is getting ARPA dollars to be able to provide identification documents to people experiencing homelessness. So there are a few agencies that are going to be subcontracted to get that funding and be able to get that out into our community. Strategy 5 is all about telling the story, engaging with the community, ensuring that they're aware of what the issue is in Green Bay, the core reasons that cause homelessness, and being able to advocate and do more to build up the services that we have in the community. So the advocacy committee of the coalition is working on 2 advocacy forums, and one was done in May on affordable housing, and there's another one coming up in July that is going to be about homeless advocacy. Additionally, we established a marketing subcommittee for this regional council to prevent and end homelessness, to do more sharing about what homelessness is in our community and making connections on the blueprint work that's happening. So in terms of where we're at, so those are some of our successes that I just walked through. Some of the things that have been done in the last year and a half that are pretty exciting to move forward in addressing housing insecurity and homelessness in our community. Obviously, there's still a lot of work that needs to be done and a lot of work that is in process. So I shared with you here the different strategies, breaking it apart into strategies of kind of what are we really trying to do right now actively. So we're obviously continuing to try to engage with landlords. That's going to be an ongoing process. We're looking to advocate for continued emergency rental assistance in this community to do more of that homeless prevention. We're also looking into a landlord risk mitigation fund, which would be able to provide funding to landlords that are willing to rent to people experiencing homelessness in case of anything happening with damages or things that might happen to their unit, that they can get some of that funding, some of that money back. And we're also looking to do more landlord and tenant trainings in the community as well. In coordination of services section, we're looking on bringing in a housing first training for providers as well as landlords in the community. Do general best practice trainings for service providers. Putting together a conversation around mental health crisis. When somebody's experiencing mental health crisis, how do we make sure that they're getting the adequate services that they need so that they don't fall in between the cracks? As well as strengthening our coordinated entry system that we have in the community. Strategy 3, engaging employers and educators. We're looking on developing a series of conversations that bring employers into the conversation of housing instability and having conversations about things that affect employment like childcare, transportation, and housing. Strategy 4, prevention and justice. We are looking to, the city actually is currently looking into translating tenant resource documents so that we can have those documents available for all of our community members in different languages such as Spanish and Mali and Somali and other languages. We're also looking to engage with healthcare teams and healthcare systems throughout the community to ensure that there's a seamless route of services for somebody that's getting discharged from the ER or from a hospitalization, that they're connected to housing and homeless services. And also making connections for financial wellness support. Looking into how do we know what sort of financial education is needed in this community? What do our community members need, and how can we bring in some more education supports around that? We're also looking at exploring the Green Bay Chronic Nuisance Ordinance and understanding more about how that affects people experiencing housing instability and people that have domestic violence history. Strategy 5, telling the story. The coalition is working on planning an annual community-wide state of homelessness updates that'll happen annually, and the community can get updates on what's going on and what are we doing to address the issue. And looking to put together a newsletter for the remainder of the time that the blueprint is moving forward. And then I also put together just a slide around what is needed from the city of Green Bay. So I pulled together things in the blueprint that really related most directly to the city of Green Bay, as in municipalities in general. So the first one being ensuring that there's enough affordable housing development that's meeting the demand that was demonstrated in the Green Bay housing market study, as well as exploring the creation of community land trusts, which I know that several staff are in the process of having conversations with different community members about that. Landlord and tenant, increasing trainings and resources for landlord and tenants. The city of Green Bay has been involved in some of the conversations we put together around that, as well as looking into a receipt of rental assistance as a protected class is one of the tasks that's outlined in the blueprint as well. Just a general support initiative, childcare and transportation solutions for this community. And then the last one around police and justice, I already talked about the Green Bay chronic nuisance ordinance that's listed in there, as well as exploring a homeless court to decrease ticketing of those experiencing homelessness and use the money saved to increase diversion programming and alternatives to incarceration. So those are the areas that we could really continue to use support from the city of Green Bay to move forward some of that work. And then finally, I just wanted to share with you the first, or the next state of homelessness that we are having. Carrie Poser is the president for the Balance of State, COC, who oversees our Homeless and Housing Coalition. And the entity that oversees our Homeless and Housing Coalition, they are coming to do a presentation of the state of homelessness over the last year, what that's really looked like for our community, breaking it down in population, and I'll be doing also another very brief update of kind of where we're at with the blueprint as well that day. So I would like to share that with you. If you're interested in attending, you're welcome to join us at the Neville Public Museum, or you can also join virtually, and I included the link in that packet as well. Next slide is just my contact information. I'm always available if any of you want to have conversations about where we're at with the blueprint or how we can move forward some of this work together. Please feel free to reach out, and I'm happy to answer any questions for you as well.
Thank you. Any questions?
I'll let Alder.
You go first.
Okay, I'm glad to see that there is someone that's doing so much work for this. This is much needed. I'm looking at your last thing about the needs from the city and stuff like that.
Yeah.
Are people getting tickets for being homeless? Maybe Lieutenant Mahoney would have, or Chief. Is that a practice we're doing here? I didn't know. Is that just a loitering ticket or something, or what are we doing on that?
Yeah, homelessness isn't a violation of the law, so I don't think people don't get cited for homelessness, but we do see common offenses that people experiencing homelessness get cited for.
When they violate a law.
Including trespassing or occasionally loitering offenses. For numbers, we'd have to get that and get back.
Now, like I've experienced with like drug courts and stuff, is this something that's in other areas where they have a court like you're suggesting in here?
Yes,
And
some other.
what kind of experience do they have with that?
Yeah, so some other municipalities do have, I'm not sure about in the state of Wisconsin, but definitely some other areas do have homeless courts. And that is, it is tickets related to being homeless, whether it's loitering or some other things, public intoxication, whatever that might look like. But it's really just a way for them to ensure that they're engaging with homeless services and the supports that are available in the community to prevent them from racking up tickets and being unable to pay those tickets in the long run. So how do we get them back integrated into some of the systems and supports that we have in our community rather than having them pay fines?
Thank you. Alder Johnson.
Alder Johnson?
Thank you, Alder Stevens. Thank you, Lydia, for coming in. And, I mean, obviously, we're grateful for the work that you're doing in our community. And I'm going to maybe just ask a question, if you can help me kind of boil this down a little bit, right? And I don't want to be so myopic that, you know, that this is an easy solution. But when I see what's happening right now, obviously I represent a district that is probably most impacted by what's happening with this in our community. When we see, I think it's 28 different organizations I've heard that are servicing this need, millions of dollars, right, that's being invested into solving this problem. What are we doing to disrupt the status quo in terms of how our community delivers services? Because what I see right now is a growing problem within a fragmented service sector, and that just seems very out of balance to me. Can you maybe speak a little bit to what we're doing with this blueprint plan to change the way that some of our organizations provide services so that we can actually see a reduction in the problem and not what I've seen, which is a quadrupling of it?
Absolutely. Yeah, so the blueprint does address some of that in terms of really coming alongside them. The blueprint talks in a few different areas about bringing in peer support, which is people with lived experience to come along and join them in the journey and be able to help them engage more in services and participate more in the process. But a lot of it is about building relationships and that's community members as well as organizations and coming alongside the problem as a larger entity and really wrapping our hands around the problem together.
Okay, again, I know it's not an easy answer.
Yeah.
I know you probably aren't going to have a clean answer.
Right.
Does the city of Green Bay really need 28 organizations working on this problem? And again, I don't want to be myopic about it, right? But it seems to me that we're investing a lot of money as a philanthropic community and not seeing improvement. We're actually seeing steps backwards. And that's where I want to, like, from a foundation perspective, are we trying to do anything to change the way philanthropy works in our community, to be more targeted, more precise, to really get the problem? Because right now we see, I think most people would agree, right, that if you don't see the problem, it's not as impactful. But I took a half a dozen calls since Friday from folks in my area that are concerned about the visibleness of it. And of course, they feel for these people. They want to provide a solution. It seems to me that between 28 different organizations and millions of dollars, we got to be able to provide a solution. So, and that's where I just wonder if what we're doing right now as a community is working or not. And if not, what are we doing to change it?
Yeah, no, you're absolutely right. It is a very complicated problem with, there's no one easy solution. And it's not just rising here, homelessness is not just rising here in Green Bay, it's rising nationally. And it's a larger affordable housing issue than it is about, services come hand in hand too, but in general, it comes down to a lack of affordable housing, and that's why we're seeing growing homelessness.
Thank you.
You're welcome.
Is there a plan or something, so kind of to piggyback a little bit off of Alder Johnson, what about the people who don't want the help? We do have shelters and they're not seeking those even in the winter months. What are we going to do about the people that don't want it?
Yeah, that's a great question. So the homeless outreach team within the Brown County Homeless and Housing Coalition has been working through that same problem of addressing unsheltered, chronically homeless, unsheltered individuals who may not be accessing the services currently. And that's why I brought up the peer support, because that is a pretty big piece of what that committee is working on and trying to tackle, and looking at what other areas have done in putting together some sort of plan. And so right now what they're looking at is a peer support run housing program. It would be like transitional housing with peer support alongside to engage people through that route, which is not traditional to what we have. It's non-congregate living, so it's not, a large facility with beds on the floor, cots on the floor. It's really housing with supports, and they have their own space and their own facility or their own unit. So we are exploring and looking into what options we have to address that chronically unsheltered population.
Okay. And with the landlord incentive, where's the funding coming for that?
We do not have that targeted yet.
Okay. And will there be follow-up? So say a landlord says, yes, I will accept these vouchers. Is there some sort of follow-up to make sure that they actually have tenants that are living there with the voucher? So they're not just saying it but not accepting?
Yeah, that's a great question. So what we would do with the landlord risk mitigation fund is it would have to be an agreement between a landlord, likely, we haven't put together this program, so it's nothing set in stone yet, but what we're looking to go in the direction of is that it would be an agreement between a landlord, a tenant, and a service provider to be able to provide case management. So all three parties would have to agree to see out the lease, and hopefully there would be no issues, right? That we would never have to touch the landlord risk mitigation fund at all, but it's there as an incentive for landlords to participate.
So regarding the landlord integrated community services, this started in January. Do you know how many current or new landlords have taken advantage of this program?
Not off the top of my head, unfortunately. Patrick Lifeguard at Brown County Housing Authority would be able to answer that question for you.
Okay, well, I know integrated community services already started it. It's a $500,000 bonus.
Okay.
They've already started it already, so.
Yeah, I don't know how many landlords have taken advantage of it. I do know quite a few, though, that they have grown the landlord pool since they started.
And regarding affordable housing in this city, do you know how many families or individuals are actually in need currently?
So I don't have those specific numbers off of the top of my head. At the H Housing and Homeless Coalition, we do put data together so that we can kind of know where we're at any given point in time. So I do not have off the top of my
Were
head.
you part of that data collection?
The ICA puts that together. So Institute for Community Alliances puts that data together for us each month.
And also another question for you. You made a comment about receipt of rental assistance as a protected class. Are you aware that the previous Common Council voted that out of being a protected class?
I am aware of that, yes.
And why are you trying to put it back in?
So, we really believe that in order to have people have access, fair and equal access to housing, that people with vouchers should have a fair access to housing as well.
And how many landlords have you talked about?
We really haven't engaged a ton in that conversation yet. I know that the advocacy committee of the coalition has kind of still has it in the parking lot of discussions, but and we do have a few landlords that do participate into that advocacy committee.
I don't know if you're aware, but I'm currently a landlord, been doing it for 23 years, so I will be against this part as I was with previous town councils. Any other questions?
Okay.
I'm a little concerned yet about Alderman Johnson's statement that there's 28 different agencies working on this. Is anybody trying to get these people together so that we're not funding this agency to do the same job that this agency is doing? And so are you working with any other agencies in this?
Absolutely, yeah. So the blueprint is not, I'm not doing all this work on my own, right? So it largely is coming from the community and the different organizations that are participating. The Brown County Homeless and Housing Coalition does act as the entity that kind of brings people to the table, and we have different committees organizations that participate on, that come together to work through issues exactly like these. A lot of what I've been doing in the community has been doing asset mapping and really figuring out who is doing what, and trying to really understand the community in terms of how can we make things a little bit easier.
Alder Grant?
I understand we obviously only have control over the city, but you referred to Brown County within this too. What are neighboring districts doing in line with this?
So I do know that Ashwaubenon is currently in process of building workforce housing with some affordable housing units included in that. But I'm not really entirely aware of what other municipalities are doing to address it.
Any questions from the public? Sure, yeah. Nobody wants to.
We need a motion?
We need to roll action is necessary.
There's someone who wants to? No, there isn't anything. So good.
Alder Eck, any questions?
Actually, I was gonna ask what Bill asked about, who's coordinating it, because I feel like as a blueprint, that seems like it would be something to be working with other organizations and figure out, instead of reinventing the wheel, what are you doing, so we're not both doing the same thing. So, I guess it would be nice to have it all, kind of talking together and figuring out who's doing what, so we don't have more than one person doing the same thing, or organization.
Yeah, absolutely.
So it's more of a statement, because he already asked the question.
Motion to open the floor?
All right, do I have a second?
Second.
All in favor?
Aye.
Nay, ayes have it, floor is now open.
Hi,
I need to know your name and your address for the record.
my name is Beth Hudak. My address is 1720 Valorane Boulevard, 54304. Think about that one, that's not good. I just wanted to say something to address the 28 agencies that are a part of the Brown County Homeless and Housing Coalition. They're not all homeless service agencies. It's schools, it's veteran service agencies, it's hospitals, it's other social service agencies that are working with, like the job center. So it's not just 28 agencies only providing emergency shelter. So I think it's really important to understand that what the Brown County Homeless and Housing Coalition is trying to do is cross-sector collaboration. So while there may be 28 agencies, they're not all doing the same thing. They're all working towards the same goal in concert. So that's all I wanted to say.
Thank you. Anybody else? If not, motion to close. Oh,
Nope.
wait, what?
My name is Christopher Zahn, 1960 Moraine Terrace, Green Bay, Wisconsin, 54303. One of the things about the blueprint, I was in the initiation of writing the blueprint. And one of the things that we all talk about, it's a multi-layered problem. And when Lydia talks about peer support, I was one of the key writers in regards to peer support, even within the people involved in the criminal legal system. So when we talk about that, we need to take into consideration, even when you talk about all the people involved at the table, and Beth said that quite correctly, it's not just all the service organizations. We have an epidemic in our community when it comes to substance use disorder and mental health disorder. That is one of the main issues that you see with our homeless population. And it's no fault of our community at large. We are in dire need of service providers. We can talk about supply and demand. We do not have the supply of licensed counselors and therapists to even look at this. If you want to look at CTC, they've been trying to hire a psychiatrist for over 2 years. They had a special committee to see how they could get one. Every behavioral health system in this community is in dire need of staff. So when you look at the compounded problem as a whole, we have to think outside the box. That's why there is empirical evidence to support peer support. We know that it works. We know that it works on substance use disorder and mental health disorder. So in that regard, we have to look at other housing solutions where in fact every service agency is still have a labor shortage. That individualized case management is even feasible, whereas peer support has an all-encompassing management style because you're bringing that lived experience. In the state of Wisconsin, certified peer specialists, You must have lived experience. There is a training. It is certified by the Department of Health Services. There's continuing education every 2 years for recertification. So it's not some type of rogue profession. It is mandated by our state. It's in state statute. So we need those opportunities to think outside the box because it is a multi-layered problem. That's why supportive housing that has peer support works, because it is a community. That's why veteran housings work, because it's veterans. When people come together as a community, that's why it works. That's why support groups work. When we talk about what is the opposite of addiction, it's connection. That's what people need, is connection. Thank you.
Alder Johnson?
Yeah, thank you, Alder Stevens. Mr. Zahn, thank you for that insight. That's very helpful. Do we have a sense of what percentage of our homeless community is affected by this? And the reason I ask, Lydia, and again, I appreciate that you're here today, but are you giving the same presentation to the county?
That is my goal, yes, to
Okay.
continue to do blueprint updates throughout the community.
Right, and the reason I ask, of course, is because the county government is the one that's responsible for social services. And if we're missing the boat on that, that's where that policy change should be inspired. That's where that funding should come from. And I'm just curious to what extent they're playing a role within this framework. And of course, just wanting to make sure that obviously you're sharing the same message with them.
Yes, absolutely. And Brown County Health and Human Services is very involved in the coalition and participate in a few different committees. And if you do come to the State of Homelessness presentation in a month, they will be able to provide a breakdown of mental health and substance use in relation to our local homeless population. So.
Okay, great. And I hope the message comes across that obviously I'm sharing with you that I think what we're doing isn't working. But also I want to be as supportive as possible, right? And so if there's a solution there, I want you to know that from a city perspective, like I'm all ears and I'll double down and support doubling down on what's necessary. And I know it's not a simple answer. We've been obviously part of the St. John's Park Task Force now for the last several months, and despite our best efforts, we're not seeing the improvement that we desire there. And I don't know that anybody has a magic wand to this. But I don't know that status quo, is going to be the effective way to approach this either. So to Mr. Zahn's point here, if there's a policy change or something that is required, like I will do whatever I can to help with that, because I think nobody wants to drive around our community and see some of the things that we're seeing, not only because we don't want to see that, but I think it affects our neighborhoods as well.
Thank you. Any other questions? No, I'll take a motion.
Motion to close the floor.
All right, do I have a second?
Second.
All in favor?
Aye.
Nate? All right.
Good job, thanks.
Thank you, guys.
So I have a question for you, though. Will you be presenting to Common Council next week?
I can, yeah. I think I'm on the docket.
Okay. So any unanswered questions that were asked for tonight, you'll have answers next week then?
Sure,
Okay, great.
absolutely.
Perfect, thank you.
Take care.
All set. So, do we need a motion for this?
No,
No,
actually,
it's informational.
We can go on to 4.
We did 4 already.
It's 5.
Five. All
Yeah,
right,
we snuck it in.
Yeah.
Thank you. That's when Steve got it.
All right, on to number 5, consideration possible action renewal application for the 2023-2024 license year for Football LLC at 301 North Washington Street. Attorney.
Well, the recommendation from staff is to not renew this application. Since the application came in, we've learned that they've since ceased operations and no longer have a lease. That's the information we have available to us at the moment.
Okay, thank you.
Motion to
Deny.
deny.
All right, do I have a second?
Second.
All in favor?
Aye.
Aye, ayes have it. Now we're on to number 14. Consideration of possible action on appeal by Elliott Health for the order issued by inspections at 3688 Church Road, previously discussed at the May 22nd Protection and Policy Committee meeting. Staff.
This is a continuation, so if you'd like to hear from Mr. Heath first, and there's a number of staff people here also from both DPW and Community Economic Development to respond. I think you all left off with some direction to go back and communicate with Mr. Heath, but I'll let you choose where you'd like to go.
Mr. Heath?
Yep. I guess I don't know. Motion open the floor? Do we, or
No.
still part of the quasi?
Yes,
So I guess there was not a lot that happened
Need to
since.
address again?
Oh,
you could, yes.
Elliot Heath, 3688 Church Road, Green Bay, 54311.
Right, thank you.
So there was not a lot that happened since the last meeting. The last meeting was a lot of confusion. We didn't really know. They said that I needed to get my pipes inspected. I was under the impression that they were going to look into DPW to see if they had a camera. Nobody ever contacted me one time regarding that, so I went out and did it on my own. I sent the videos just Friday, and I have not heard back, and that's as far as I went. I did cut one of the pipes shorter so that it drains further into my property, and that's really all I have at this point. So right now, the sub pump pipe to the side is not draining anywhere near the drainage ditch, and the one along Church Road from the stormwater, or from the downspouts, I got inspected and everything checked out, looked good, and that's as far as I went.
Who did your camera?
Green
inspection?
Bay, I just gotta make sure I do it right. Green Bay Pipe and TV.
So you took it upon yourself in the city?
They never reached out to me. I reached out to Jennifer Grant. She said, has anybody reached out to you? They was gone. He never once said anything, because again, the last time we talked, we sat here for an hour, and I thought that DPW was gonna get involved. I still have not heard one thing from DPW regarding anything, and they were going to check, the people on Zoom were gonna check to see if DPW had a camera or that had any access to that first, because the last thing that I said to you is, I don't think that I should have to pay for it if they told me that I could. So I had enough, so I did it on my own, had it, the guy said everything looked good, and that's as far as we went. Tried to pay for this service, because DPW, again, never reached out. There was one person hanging around in my yard one day, and they never said what they were doing. They were measuring with some tape measures, and I still don't know. So again, the confusion is still rampant, and still, I don't know. For some rainwater, literally.
What was the cost for the cameras?
$100.
Anything else you'd like to share with us at the moment?
Not at this time.
Okay. Thank you. Any questions for him?
No, we need to hear from staff.
Yep. All right, staff. Inspections, DPW. Want to go
Well,
first?
seeing as I'm the director of the department, I think I can address some of this. No communication ever came to my desk.
Steve, sorry, did you want to introduce yourself?
Steve Grenier, Director of Public Works Department. No communication came across my desk, so I did not know that there was any kind of a request for us to do any televising. The televising would have been on a private lateral. We do not televise private laterals. We televise public sewers. End of story.
So inspections didn't contact you?
To the best of my knowledge, I don't remember seeing anything coming across requesting me to have my staff televise a private lateral. If that request would have come across, we would have denied that request. We do not televise private pipe. That is the homeowner's responsibility to televise.
We were hoping that
Now,
might be different due to the circumstances, but I don't really want to focus on that end anymore. I want to more know, is the work done, are we good, or is there still an issue?
my understanding in speaking with staff is that because Mr. Heath removed that pipe and it's no longer directly discharging into the greenway, as long as that discharge doesn't create a nuisance hazard, it can't cause erosion. If it starts causing erosion, we're going to have some riprap or some erosion protection put in there so that we're not causing that material to wind up in the greenway, which is the problem with the pipe being directly into the greenway in the first place. Provided that none of that happens and it's overland flowing across his property and then naturally flowing down into the stream, we're satisfied from a storm sewer and erosion control perspective.
Okay. And I'm trying to remember, were there fines assessed before for non-compliance?
There was a reinspection fee.
Reinspection fees?
I'm Jason Slack, I'm the plumbing inspector. So I was one that was originally requested to go out by Public Works to look into this. So there was reinspection for non-conformance.
And
There
how
is some
much?
there is some issue with the county registered deeds, I believe. Things are still, on this property are still showing up as the developer. I'm not sure why that's been happening. I think there's been a delay in some of the mail getting to Mr. Heath. I've not seen the video. There was I believe last Wednesday, my superior, Paul Van Kelster, sent Mr. Heath an email requesting, and then he did not hear back as of the time we came down for the meeting tonight. If DPW, Public Works is okay with the discharge points, that's just fine. The state plumbing code that I had to cite was if it can, stormwater can discharge provided it is not one of two things, create a nuisance, and it's not forbidden by ordinance. If DPW is fine with the pipe being in the greenway or into that pond system, then I don't have an issue. I've not seen the video. I just did check my email and my junk mail. I did not see anything. If someone can forward me that video right now, I can look at it here right now and see what we have. We can move on, but that's where we're at right now. So
Do you know how much the reinspection fees came to?
I can look and see how many were issued.
Yeah.
Email me if you like.
I'd like to get this done today, though. 'cause
I can.
Right. Well,
I have my computer on my lap.
everything would still go
Well,
to
can you take a
council.
moment right now to find out what the total is?
That's what he's.
Assistant director or director back there too.
I can look right now.
Maybe if you'd like Jason to look at it
So-
immediately, I'm not sure that that's appropriate to ask you to do your work on.
But I
that.
sent the email on
Okay.
Friday.
Do you know what
Right,
you sent it to?
I
I
would
sent
say,
it to Paul, Jason, and Cheryl.
okay,
You have a copy of that email?
Obviously, it doesn't show up. I sent it.
okay, Paul, Steve, and Cheryl, okay, someone should get it. But, and so, I'm thinking,
I checked 500 times because I wanted to make sure that it went through.
okay, I would like to make a motion that we rescind the fines to cover the cost of the camera, and that we,
This is rainwater.
pursuant to, by Tuesday, we should know if the pipe checks out and if there's any other issues, so it'd be contingent on that. So I make a motion that we...
I'm going to try my best to send it to him now, again.
Okay. I make a motion that we rescind the fines contingent on Tuesday's meeting, that everything checks out and we can just put this to bed.
Are you including reimbursement again?
No, I'm rescinding the fines to pay, to wash it out.
The inspection fees.
Rescind the,
Alder Scannell?
Pardon?
You're saying to grant the appeal of the reinspection fees?
right.
Okay.
First time you mentioned the camera too,
I
though.
need to give you a dollar
Well, I
amount.
was just gonna amend to reimburse the camera fee.
That's fine. I can just, I'm going to get this done.
Remember? We didn't know, we thought maybe staff might be able to do that, remember?
All right, but
It's
he
fine.
didn't even heard back, so he did it on his
Right,
own.
right.
I will
did it
cover
on
the
its own.
$100. I'm not
But
going to
if
go with
we-
$100. I just want this done.
I know, we're
Right,
just trying to
but
help.
if we rescind the reinspection fees, that should help cover the cost of the camera.
And I can't open it on my phone because it's,
Yeah, just
Right.
the lack of.
Well,
because it's a.
I'll make that motion, you can amend it or whatever, I'll make that motion,
They checked it out, it's fine. I mean,
that we
It's
rescind the
literally
fees, and,
So you need to, if you want to, you need to rescind, if you want to rescind the fees, you have to deny the appeal pursuant to the fact that it's satisfactory. If you want to do a later date, because staff hasn't had a chance to review this, so if you want to, if we want to go down the road of assuming it's going to be okay, it's deny the appeal of the order, but.
okay, so I make a motion to
Grant the
deny the appeal of the
fees.
order, which would
on the-
automatically rescind the fees, or do I have to include
Nope,
that?
separate,
Okay, so then, can I make it all in one motion?
yes.
Okay, so I make a motion to deny the order and
Deny the
rescind,
appeal, Alder Scannell.
deny the appeal, thank you,
For the
deny
order.
the appeal and rescind the reinspection fees contingent upon staff checking everything to make sure we're okay by Tuesday. Does that make sense?
June 22nd.
Yep. So staff's got, on their time, not on our time, they can go over everything, so they're not working now, no need for that. Staff will have time to make sure all the ducks are in a row, the city's fine with everything that it is, and
I will second that if you need a second.
We'll amend it.
Yeah, I'm gonna motion to amend that to include refunding of the camera fee,
from what would that?
$100.
Right, from what fund would we refund? Where would that money come
Don't worry
from?
about it.
How would we refund?
For the financing?
Ms. Grant, don't worry about it.
Or refer to?
Okay. Okay, retract that amendment.
Oh, okay.
I have a motion, I have a second, all in favor?
Aye.
Aye, nays, ayes have it.
So Tuesday,
Do I have to just, how do I know this is correct?
you'll be notified.
Can we set up a time to, if it's not going through email, can we set up a meeting to see the recording?
I will,
Okay,
Here, he's got my card, so,
okay,
yeah, I think it's file size, is my guess.
that's what I'm wondering.
Okay.
we're just trying to be efficient.
Yep. Thank you. That's it then, right?
Okay, number 6, where are we, number 15?
15.
Consideration possible action on appeal by Tammy Southwards at 3490 Yorkshire Drive regarding orders. Staff?
This is our original appeal for inspections orders, so you can hear from the property owner and then staff if you'd like.
Okay.
The property owner did have to work tonight, but
Yes,
she
sure.
did let me know.
Thank you.
But she does want this to remain for
It should be
discussion.
voted.
Yeah, all notes are in there. She wrote a letter, which is all in the packet.
So would you like to hold this?
Or does she?
No, we would like to move forward.
Okay.
Yes, you can go forward based on the information you have in the package.
She
In
did
a
make a
written-
statement in the packet.
Written appeal.
Okay.
And if you'd like to hear from staff, they're present.
Yes, staff.
Yep.
Come on up.
Do you want us to go first?
Yeah, well, she's
I'm sorry, the property owner isn't here. She provided, it's in the package, she provided a written
So-
appeal.
Paul Vinkowski, Chief Building Official for the City of Green Bay.
Now, is this the one we dealt with before, the same?
No.
No, this is different?
It's a neighbor to the
Ne-
one that we dealt with.
Well, I mean, same area.
Same area, yeah.
Okay.
The 3 parcels that are affecting the 4th yard, yeah. So Tammy and I spoke last Thursday, June 15th, and I sent her a recap email. It's in the packet that you guys received. Basically, I was pointing out through calculations that Jason had done, the amount of discharge that's coming from her house, from her shed, and from her backyard. And she pointed out that she wanted a rain barrel. She said that I was against rain barrel. I'm not against rain barrels, but a rain barrel to catch the amount of water that's coming off of her house isn't going to do the job. So just to give you, I won't go through all of it, but the golf simulator contributes 8 gallons per minute. The house, what's left of the house to connect, contributes 15.2 per minute. And then the backyard itself contributes roughly 27 gallons a minute, and even if we cut that in half, we're still looking at 13 gallons per minute. So that total is about 37 gallons per minute that goes through her yard into the 4th yard. We talked about other options that were in here. One of them, she basically didn't want any accountability if the issue came up again in the future. So I said we could wait until the 10-year event and see if it floods, but if there's an issue, then she's gonna have to do what we're telling her to do, connect those last 2 downspouts. And I didn't hear back after I sent her this email, recapping our phone discussion.
Do we have the drawing? I see in the orders, it's underlined, see attached drawing, shows 3 downspouts circled. I've not seen that in there. What's the
3
difference between what was circled and what she did?
The 3 downspouts were on the one side of the house and 1 on the simulator. 2 on the house, 1 on the simulator. The other 2 that need to be connected is 1 on the house and 1 on the simulator, the other half of the simulator roof. So the orders originally said connect all rear yard downspouts to the storm drain system, the city system. But there was an intervention in there and they were advised to connect the most urgent ones, which they perceived to be the 3. Well, I just told you that there's a lot of water still coming off the property and off the roofs that we want to connect and eliminate.
So they are going to, it sounds like, we will reroute downspout on the Gulf Shed to connect with the city line. That's
She
not.
was going to, but when I said we still got to address the house, she said, then I'm not doing that.
Oh. Oh,
So we're at a standstill. She was basically saying, I'm not going to do it because we don't think we should have to. But the pictures from last time that we showed of the neighbor's house that's flooding, the quantity of water that's coming off of her house, it's fact, it's not opinion.
mhm. And you mentioned something, you wanted to wait for another 10-year event to measure something? Or
Well, she was pointing out that this last storm, when it rained last week, that everything was dry. Rain barrel only got half full. And I'm
Right.
like, that's not a 10-year event storm.
I see.
So, and then that's when I gave her the option, it's in the memo, or the email I sent her, it was to wait, if that's what she insisted to demonstrate. But then, unfortunately, wait for that event, floods the neighbors, then I write an order, then she cleans it up, or dries it up. But that impacts the fourth property owner, because we didn't make her connect now, knowing that she should, based on the amount of water that's being discharged off her property onto that fourth property.
So it's the city's position, she should act now.
Yes. See, and one of the pieces that gets overlooked as we're discussing this is the 3 properties involved all did projects, all of which brought in fill, all of which results in the water landing in the fourth parcel. They don't see it that way, but that's the facts. They elevated their backyards, which dumps the water in the fourth parcel.
I don't have questions, I was just going to say it later.
I'm good, I understand.
I get it. All right, thank you. Comments, questions?
Yes, I have quite a bit to say. So when we initially discussed this issue, it was asked by you to work with the contractors, if they had a difference of opinion, to talk to them. So I was contacted by the resident because the contractor did view what was being asked of her to do. And he said, with my professional opinion, if you look in the packet, there is a letter from the contractor that says, with his expertise, he thinks that the 3 lines that were buried is sufficient enough. And they reached out to me saying, we want to submit the work or the permit for this, if this is okay, agreed upon by the city. I had emailed Paul, CC'd the contractor, included the invoice to show the 3 drains that they were going to bury. The response, which is also in the packet, was have him submit the work order. So at that point, the contractor, it was his assumption that that plan was okay to move forward to submit the work permit. He did so. That permit was approved by the city. He moved forward and did the work. So now the city is doing the final inspection and saying, well, no, that's not enough. So that's where there's frustration and lack of communication, because we were trying to work with the contractor on what he thought was appropriate, what the city thought would be enough to fix the issue, was told to submit the permit, did so, and now is finding out that it's not enough after spending about $3,500 on burying those. So that is where we are today, and I don't know yet if you guys need a moment to review all that or have questions as to that.
I thought this was a different property, wasn't the one that we just...
Correct, it's the neighbor
The neighbor,
to
Okay.
the left.
to the left, okay.
And it was also talked about that if these 3 do make improvements to their drainage, we would see if it had improved. When it rained all day on Tuesday, there are pictures that were sent to me. There is no water in the backyard, and it rained for about, 8 hours on Tuesday? I mean, it rained all day.
But that's not a 10-year event. 10-year
I
event.
understand.
Okay. as a high-intensity rain. That was just a slow, gentle rain where it was absorbed.
Yep, but they were, every time it rained, pretty much, they were getting water in the back. I mean, it was way more common prior, is my understanding. So it was also talked about that the fourth property who made the complaint had a history of water in the backyard, that it was going to be their turn to do an improvement. So I guess again, the contractor was seeking to work with the city, took out the permit got approved, did the work, and now is saying it's not enough, and the resident is unsure where that breakdown of communication happened.
Well, do you know what the city's position was on all that? Did the city think that that might be sufficient, or how?
No. So in that email, because I don't have it in front of me, did it say 3 downspouts?
The invoice showed 3, yep.
The scope of work said 3? Because I'm the one that responded to it and said, give me a drawing that shows what you're doing versus a scope of work.
Well, after that, I don't know what he submitted, I would
No, I'm talking the scope of work that he submitted. What did it say in there?
be referring to the invoice that I had attached.
Yes.
Yes, it did say 3 downspouts. For quantity, there was 3.
But without knowing where those inlets would be for those 3 downspouts, you can't answer that question, which is why I asked for an exhibit depicting that.
So did he ever submit an
He did,
exhibit?
and that was
Okay.
an internal issue that we've since rectified. The permit got issued without making it back to Jason's desk or my desk. So that's how that happened. But it doesn't neglect the fact that the orders originally were, and still are, to connect all rear downspouts, which would be 5.
So the 3 are good, you just
You're
need
good,
2
we
more.
need 2 more. I also, in this
Ah.
email to her, proposed a solution, it was actually Jason's idea, to put a yard inlet in front of the simulator to catch the water that's coming down the pond, that, from that house downspout. It'd be cheaper. Put a yard inlet right there, that'll get the house water, and then take the downspout, like she was gonna do, and connect it to what's already been connected from the Gulf City. Be a lot cheaper than digging up her whole yard and putting it over here to connect to the house. Just put it over here where there's already piping for what he's already installed.
So in other words, the 3 really isn't an issue. I mean, it's not, that was good, that helped the problem, but it didn't fit the orders completely. They took the work order and did 3/5 of it.
The 3, yeah.
I had to think about the math there.
So when the permit was submitted, is it normal for the city to go back at that point and say, this is great, but you need to do these last 2?
No, what I said was there was an oversight on how that was processed, the permit was issued. Normally, it would go back to Jason or myself. In this particular incident, it didn't, because the scope of work matched the picture, so it was issued by the admins. Going forward, that option's not out there for the admins to do that, because they gotta look at too many places to see if there's a complaint on record where there's other issues going on that they wouldn't be aware of. So that is rectified already in-house by us.
But even so, it's still, I mean, it would just cost more if they had done all 5.
Yeah.
I mean, it's not like
They may
they're
have-
out money. They're stepping towards solution, they just need to step further.
Correct.
And that would cost more money anyway. So it's not like
Well-
the permitting really doesn't make much of an issue. I mean, they needed to take care of those 3, they took care of those 3. It's to the other 2 that still need to be addressed, and there's a different solution that might be cheaper that's been offered.
Yes,
Have you heard a response on that?
that was in the email.
Do you know anything, have you heard anything from the constituent on the proffered solution by the city that would be cheaper?
I can check with her. We were kind of just waiting to see how this discussion went. So would she need to pull another permit?
No, I'd add it to the one that's already pulled.
So what I'm concerned about though is having people come back out to a job that they were already at, had stuff out there, it can sometimes hour-wise take a little bit more. Yeah, I don't know, I'm a little, I mean, I had reached out, our department knew this was coming. It's a little frustrating when there's oversight that this, I mean, it's, the contractor did what they were supposed to do, the resident
Well, I would disagree. The contractor did not do what he was supposed to do. The contractor took the advice of connecting the critical ones as it was described to him instead of following the orders. The contractor should have called our department and said, someone's telling me I can connect the important ones, not all 5. Is that true? He would have got a, no, that's not true.
No one told him that. His letter said in his expertise, he believes that this would solve the water issue. The direction of one of the, he did not, the direction of one on the side of the house isn't even facing the property that is experiencing the issue.
No, those aren't the 2 we're talking about. There's 2 on the side of the garage that go to the neighbors. Those aren't in question. There's another one on the rear that does go into that pond, down to the bottom, in front of the simulator, out the side, right into the neighbor's property.
But it's my understanding that pond has a pump that circulates it back.
That pump isn't gonna keep up with 40 gallons of water coming down that pond and dumping into that pond. The water's gotta go somewhere. The pump can't put more water in the pond than what the pond can handle. It's gonna overflow and go into the neighbors.
So I just want to read really quick, the letter from the contractor. As a licensed utility contractor, it is my professional opinion that no additional drainage storm sewer work is needed at 3490 Yorkshire Road. The remaining downspouts requested for connection by the city of Green Bay are not contributors to the nuisance complaint filed by 3485 Edinburgh Road. Water discharge by the remaining downspouts is contained within the property by use of the detention pond according to calculations provided by SPS 382. The detention pond and surrounding grading has the capacity to contain the remaining downspout discharge during the rain events and does not risk overflow to any adjacent property. So I just want to clarify that is his professional opinion, not that he was told by someone that he could do that. That was his opinion, his professional opinion, submitted the work permit for it. It was the assumption then at that point that it was approved by the city and sufficient work.
Well, I don't think the city gave the okay for that as being sufficient. They issued the permit for the 3, but they didn't say
Indirect.
that,
I think all the grant is claiming indirectly we did. By issuing a permit for 3, we said, don't worry about the other 2.
indirectly, I suppose, okay.
And I can accept that part of what you're stating, but
Well, and had it gone to Jason, he probably would have said, well, wait a minute, we do need,
it would have been denied.
correct. So I think that's the issue.
Did you have?
Mr. Chairman?
What?
So on February 15th, I did receive an email from Mr. Tyrell, who's the utility contractor. And Joe, in his second to last paragraph, he said the homeowner at 3490 Yorkshire stated he was required to connect the downspout on one side of his shed, the other one drains towards the front shed, and they were told they could install a rock garden. Is that correct? My response to him, the house at 3490 has been ordered to connect all their rear yard downspouts to the storm sewer system. At some point after that, unbeknownst to me, they were given advice to use their professional opinion and do what they thought was proper. He sent in the permit with a sketch of what he thought was proper. I assume responsibility for that. I didn't see it, but we should have, so I'm sorry for that, but we didn't see it. But it did not follow what the advice I was given. And as far as the rain totals, I just looked at Channel 11's total for last week was 0.82 inches of rain on that day. And according to a 24-hour 10-year rain event would put down 3.46 inches of, in 12 hours put down 2.97. Better than 3 times what happened last week would be what we would realize in a rain total. 2 years. And that's the code, that's the standard of the 10-year, 24-hour. That's the standard we're required to size stormwater management on the plumbing on the private side.
And I understand that a contractor with a certain amount of experience stated that in his professional opinion, what was done was sufficient. But you've got a plumbing inspector who's got close to 30 years worth of experience and 2 professional engineers who are disagreeing with that. You've got a contractor who is paid by the property owner. One of the things I love about engineering is oftentimes there's not an answer, there are multiple answers. And then you look at cost to benefit ratio and what are you trying to protect? In this case, you've got a contractor who's being paid by the homeowner. So that answer is going to be beneficial to the homeowner. And you've got staff who are trying to protect the city. So they are interpreting the city ordinance to protect the city at large. So you have quite a bit of expertise contradicting what one contractor came up with.
I understand that. I think the issue is the contradiction is not coming after the fact the work's done. And things were okayed, signed off on, and
Well, and I think what Paul was saying is that an error was made in signing off on it in the first place. The contractor did not do what was ordered. The contractor interpreted and did less than what was ordered.
so what's also kind of confusing though in the orders, it just says all downspouts. Never, from what I saw unless I'm missing it, it never once gave a number, a clear number as to how many.
It says all rear downspouts. So without going on their property and counting them all, saying it's 5 or it's 7, it's 9, it's 2, if we use the word all rear downspouts. Because what if we miss one? And then we gotta go back and say, well, we didn't go on your property, you didn't want us on your property, we only counted 3 from the neighbor's yard, and we didn't see the 4th one around the corner. That 4th one has to be connected. So we use the word all downspouts.
Well, it seems to me, I understand concern about the error, but they were gonna spend money anyway to do this, and what they did is valid, it's good, the money is well spent, and there's another option that, I mean, it would've cost them more to include the other two anyway. This other option saves them some money and addresses the issue. It seems like, unless you want to, and the error has been rectified to, it won't be happening in the future. And I don't know that it really damages, they're damaged by it, because they would need to do the work, and the work they did was good. It's not like they have to undo it or redo it. They just have to do more, which they would have had to do anyway. So I'm not sure where the grievance is or what the problem is, other than they need to comply with the city orders to protect this property behind them. I mean, we gotta think of the property behind that owner too. I mean, that's why we have the ordinances, to protect other people's property, and that property deserves the city to stand up and protect it. So, I should hope that after this, they realize they need to come up with a solution for those two. The city's trying to help. If they want to do something else, as long as they run it by the city, it's okay, you know. But they cannot keep flooding their neighbor's yard. I don't know.
So as you said at the last committee meeting dealing with this, that if there was a difference in professional opinion between the contractor and the city, that
That
they would
was that
communicate.
particular case.
No, you said all of them.
Oh, they weren't part of it before, right?
No, but you just said if there was a difference of opinion in solving this water issue of the 4th property, there was 3 involved. Yes, that initial individual appeal was. All I'm getting at is they followed the direction to submit their professional opinion. They got that permit approved.
This is a different case. I'm confused. I don't.
Correct.
Right, so I'm going case by case. I don't know that what I said for that case applies to this case. I mean, that was completely different circumstances and everything. I mean, here.
Yeah, if I could interject. I don't think it was interpret professional opinions from contractors. At the last one with Tammy, it was work with the contractors, get the work done, and be amenable to their schedule, and meet that we set June 1 as the completion date, be open to that based on contractor availability and get the work done. It wasn't about changing the orders relative to the other properties or any of the properties.
No, but there was a difference of opinion with Vanden Elsen's property, correct?
This one, well, yes.
So, if we're gonna work with one resident, the contractor's opinion, why would we not value another contractor's opinion? It's actually the same contractor. If that's my understanding, Joe actually dealt with all 3 of these properties, the contractor. So he would know collectively what is going into this yard?
It's a slightly different situation. a considerably different situation. The swimming pool is flat. Her 1 yard inlet on the far side of the pool would have to drain across all the grass, past the pool, down the yard, into the fourth property. We conceded with that one not to do that. But this one, the golf simulator one, it's a lot of water coming from theirs. And they filled in that whole corner of their property where that golf simulator sits now. The water now goes to the fourth property. So I know, I hear what you're saying, but we're comparing apples and oranges. One's a steep hill, one's flat. One you're gonna get infiltration on, the other it's running down that rock pond garden that goes and dumps right into the neighbor's yard. It's apples and oranges that we're trying to compare, and we can't.
And I thought it was more work with the contractor, not so much negotiate with the
Right,
contractor.
correct. Work with the schedule, work with coming up with a solution versus,
I don't think the contractor's not working with the city. If they would have denied it, had it gone through the regular procedure, he would have then corrected the work order, resubmitted it, gotten approved, and we would be off running. It's not that people aren't working with the city. I think that's kind of misleading. The issue is a permit got submitted under the understanding that this was sufficient work.
Well, I think that was implied, but the city said it needed all 5.
No, there
They
was no
submitted for
number.
3. I mean, how do we know, how does the city know that they were gonna do the 3 and then take this other solution that is proposed, which I take is not
Just after.
the same, well, it came after, but how does the city not know that have another solution for the other 2?
And 5 was never stated to begin with.
Well, all rear. I feel, I don't see a grievance. I don't see a grievance. I see there was an error and a misunderstanding, but again, the work that was done was good. It's not like, I could see there being a grievance if they spent money and the city's saying, oh no, that don't work and you gotta undo it. No, it's great, it's fine. But they only did 3/5 of the job, they gotta finish it. I don't, I don't see a grievance. I can understand a little frustration with the misunderstanding and the miscommunication, you're thinking you're done and you're not, but the original orders never changed. I don't know, I don't think, and I don't think the city came out and said, this will do it. It was an input, they implied that since it was permitted, it was okay. But the city didn't say, the city didn't sign off, the city didn't say this is okay.
the orders weren't approved and finalized saying complete.
Right.
They'd still be orders out there.
So I can understand how being confused, and I can understand the owner being confused and upset and frustrated. Because there was a confusion on that permit. But other than that, they're not out of pocket, because what they did was necessary and good, and a part of the solution. Now, the city's even offered another solution that's gonna save them some money, and that's what they need to do, to protect the 4th property owner from being flooded, which is, I think, the city's responsibility. So I can understand and appreciate some frustration, but I don't see a grievance. I don't see how you wouldn't want to not flood your neighbor, just being a good neighbor. And of course it sucks, no one likes to spend money that you think you don't need to spend or don't want to spend or rather do something else with, but these are the times we're in, where we have way too many rain events. 10-year rain events are not every 10 years anymore. And that's something we all have to adjust to. Unless I'm missing something, I don't see how they're out any money. They just have to, which they would have anyway, if the permits had been denied, spend more. So I make a motion that they need to follow city orders and complete, one way or another, submit a plan to address the last 2 drains and implement that in a timely fashion.
Alder Scannell, if that's the motion you're making, it's deny the appeal, please.
Yes, I deny the appeal.
Have a second?
Do we have the option to see how the summer plays out?
From my seat and Jason's seat, I'd say no. But that's, if you guys decide that's the direction you want to go. I mean, let's say we get another 10-year event and it floods the fourth property again. Then what? What do you tell that taxpayer that we took a chance? To me, it's no. The evidence right here and the calculations on the amount of water that's leaving that property and the issues that they induced in conjunction with their two neighbors, which by the way have connected theirs and they're compliant now. Why would we let this one change what they're doing?
The water, when they're having water issues though, it's not reaching their house.
It's flooding their backyard and killing their trees, which in the
They've-
past, before the other three neighbors filled their yards, that water was dispersed between all four properties. Now it's all on one property. That's what we're looking at. And that's how we address the orders based on the situation that's been created by these three projects that took place and created the issue.
And I would understand that if no improvements were made. But we are getting an opinion from someone who does have expertise in this saying that it's enough. So in my opinion, it's worth to give that expertise a shot. If the damage isn't reaching the house, the water has already accumulated in their yard for years. That's nothing different. You're correct. It was shared between 4 properties. Three of those 4 properties made improvements. This person made improvements. The contractor believes it's enough to be okay. I understand there's different of opinions. That's why people seek second opinions, even with medical professionals. That's no different than everyday life. But I think it's worth this resident spent $3,800. There was an assumption, there was an error made. So I have an alternative motion, so we can vote on yours first.
Okay, well, I'm gonna talk to my motion again. I think you're being unfair to the 4th property owner that's being flooded. I think you're being unfair to the 2 property owners that complied. And I just don't see, Paul said it. I mean, why would we make an exception for this property owner? We know scientifically what's going to happen. We know we have rain events much more often. And again, yes, they spent money. They're gonna need to spend money. They're gonna need to spend more money. They would have needed to spend more money anyway. I just don't see the issue here. I don't see why we're giving them a pass to potentially flood their neighbor and not be in compliance as other neighbor. What are we setting up as an example there? I believe in my motion. I'm standing with my motion.
Motion to deny. Motion to deny.
Motion to deny, but there needs to be a second. There hasn't been a second yet.
I'll second.
A second. All right, all in favor?
Aye.
Nays?
Nay.
3-1. Thank you.
Thanks.
16. Ready? Consideration of possible action on request by Alder Scannell, District 7, to review the possible action restrictions on malt beverages for quad cycles. My understanding.
I make a motion to receive and place on file, and I made that communication. I was not aware that this was already ordinanced by the state, and we cannot create an ordinance contrary to the state, so I make a motion to receive and place on file.
All right, do we have a second?
Second.
All in favor?
Aye.
Nays? Ayes have it.
Can I ask what a quad cycle is?
The bike pub. You see it pedaling around, and they can imbibe along the way, and they go to they hit different bars, they go bar hopping. There's also the Foxy Peddler on the Fox, you seen that one, where they're pedaling away and drinking away on the...
Sheltered.
Well, we will have to get on a bike ped together here, and we'll tour the city and... That's something for the council to do.
Number 17, consideration of possible action request by Alder Johnson, District 9, for a revision to the city's process of handling sign permits to allow for one application and one point of contact to facilitate the approval of sign installations. Alder Johnson.
So I've been meaning to submit this probably for a few years now. If you're not aware, especially in the downtown area, if you submit an application for a sign permit, you need to submit 3 different applications. And sometimes the different departments aren't talking to each other. So if you're someone who submits a sign permit once in your lifetime, you don't understand that process. It took me several years to figure it out. As someone who's helping businesses do this. So you have to submit a sign permit for, I think it's called a revocable occupancy permit to hang a sign over the sidewalk. You have to have your actual sign permit, and then you have to submit another permit to get a certificate of appropriateness through the Landmarks Commission if you're a historic property. So I think for most people, it's very confusing, it's very convoluted. I think there's no reason that this can't be a simple process, one form. Internally, we figure it out and navigate it. And so that's my request, is to adopt a policy that makes it simple for the user.
So refer to staff?
Yeah, I think you can refer to staff. They can come up with how they're going to handle it, but they need to bring it back, I think. and
Right, that
explain to us
refer to
how
staff and they bring it back.
that they can support that and figure that out internally. So,
Yeah, I'll make a motion to refer to staff. Would you say then that this is a sign of the times?
and I exit this conversation.
Does it refer to staff for a policy change?
For a policy change, yes, and how it would be implemented.
Okay.
Okay, do I have a second?
Second.
All in favor?
Aye.
Nays? Ayes have it. Thank you. You have another one. Consider as possible action request by Alder Johnson, District 9, to terminate the requirement of paper submittals of site plans. Alder?
So this was brought to my attention by a local builder, that whenever we do site plan reviews, the City of Green Bay requires that they bring in a paper copy of those site plans. So they have to obviously print those at their expense and then make a physical trip down to City Hall. This was brought to my attention, I mean, when you think about, we hear this all the time, how difficult it is to do development in the City of Green Bay. I think it's a death by 1,000 cuts. I don't think it's anybody's fault. I think we've just become this bureaucratic machine and become used to doing things a certain way. I placed a couple of calls to other local municipalities nearby. None of them have this requirement. All of them say, no, it's electronic submittal. Send it by email. If we want paper copies internally, we print them. So this is really just a desire to make this more customer friendly. I'd love to find where those other 1,000 cuts are, but to me, this is the first of many that I hope we can get on board and say, no, if we can do this electronically, that makes it easier for developers and builders.
This would be a cut above the rest. Is there anyone here from staff to speak on this at all?
I checked with our department, we don't have a problem with receiving them electronically.
Motion to approve?
If you refer to staff, it would be helpful to just take immediate action to change probably a procedure. This one is an ordinance, so we.
Oh, it's ordinance? Oh.
Well, we could, this is the ordinance that requires it in writing plus 2
See, I
copies.
didn't even know that.
11 by 17, I believe.
Yeah,
44,
yeah. Then-
right?
then
So,
we-
but we, the law department, we could take action to sort of just adopt a procedure where it could be electronic.
That's true, because I think Public Works actually uses the paper, so we probably should refer to
So
staff.
we just refer to staff and we could take any immediate action if possible, and then an updated ordinance.
Won't the water works just flow with the rest of it? So refer to staff to
Yes.
update the
A
ordinance?
procedure if possible, and ordinance as necessary.
I like that motion.
Okay, do I have a second?
Second.
All in favor?
Aye.
Nays? Ayes have it. Thank you, Alder. Okay, number 19, consideration of possible action on general ordinance number 4-23, an ordinance creating section 1095 Green Bay Municipal Code related to massage establishments. So I understand that many alders have worked on this one, but Alder Eck is in the district now, so she's spearheading the most of this currently, so thank you. Attorney?
Yeah,
Logan, you want to introduce yourself? Introduce yourself and then you get
I'm
started.
Assistant City Attorney in Logan Wood for City of Green Bay. I worked on drafting this ordinance, and I can present to you some information. If you haven't read through it, I can give you kind of a breakdown of what's going on here. So this is a little background here. The state regulates massage therapists at the state level, so we don't regulate that. this would be a license for massage establishments for a physical location. So there would be certain rules and regulations that those that qualify would follow. If certain locations operate without a massage establishment license, they would be subject to a public nuisance. So those are the two kind of categories that we're looking at right away. There would be certain exemptions. So only those that are practicing massage therapy that would have to apply for this. If this is a physician, a surgeon, chiropractors, physical therapy, those would be exempted from this license application. There are certain appeal rights for those that don't qualify. If they feel like they do, there's a certain appeal process that goes through this. That's why it's a very voluminous ordinance, but it certainly needs to be to protect all the due process for all residents. It's kind of a brief overview. The other exception would be barbers and beauty parlors were limited to the head and scalp. So, kind of a general run through it. It runs, the application, the license would run through January through December. It's a yearly license. So that's kind of a general overview.
I'm assuming it's safe to assume this would also exempt like NWTC who does massage therapy school, but they also have hours that they have to complete in order to become licensed.
Yep, and that is certainly, but they would have to work with a qualified, somebody who has a license to begin with. So that would be acceptable. That's under the state. All that we would require that there be somebody that's licensed with a massage establishment license as well.
Okay. Yeah, we was asking other questions.
No, good work, yeah.
Yeah, good job.
Alder Eck, any comments? Come on up.
Yeah, I think, come on up.
Oh, hey.
Is that what you're saying? Come on up. Should I sit next to Logan here? So this is something that has been in the works for quite a while. And I do want to mention Leah Weicker, Executive Director of the Military Avenue Business District, kind of became aware of there being, what did you say, nuisance, public nuisance, specifically in the Military Avenue area, that there's several questionable spas just within that area. There's other locations, but anyway, so it's about 2015 working on it, and yes, it's gone through different alders. It's been a couple of years since it's been proposed. There's been various roadblocks that have come into play. So I just look forward to this moving forward because I know that I've gotten complaints. I know that Leah's gotten complaints and she's had problems, and she probably will come and speak on this, so I won't say too much about that, but getting people to come in and lease on either side of the businesses that are in question. So I think this will help to regulate it with having specific requirements and having a license and, specific licenses for the massage therapist. I just think there's a lot of these specific things in the ordinance that are going to be helpful to eliminate those that are not just, in my opinion, legitimate spas or massage therapists.
And kind of to piggyback off that, Attorney Wood, you kind of said it's almost like creating a business plan with our spas, kind of like we do with our, bars and restaurants that have liquor licenses, correct?
Yep, absolutely. And it's part of the safety that we provide for the community as well, so that anybody that goes to one of these establishments knows what they're walking into, especially like you said, a liquor license. We know what to expect when we walk into a facility like that, especially with certain kind of safety standards that we're going to see at all times. So that's something also that inspections will also have an opportunity to make sure that they're ensuring that these places are meeting these regulations.
I'm for this, but I remember several complaints about an establishment on Military, but it was the North End in the Village of Howard. Are they doing anything similar?
I'm not sure if that particular village is doing anything. I know other municipalities have been doing things to address this. Again, this ordinance applies to those who apply and are qualified. Like I said, if an establishment didn't fall under this, they would be considered a public nuisance under this ordinance. So this ordinance would really help make sure that those that are eligible are all operating under the same rules.
And just for clarification, the one that you're referring to is no longer operating.
And another municipality, for example, is Milwaukee, correct?
Yep, Milwaukee, there are others as well, Kenosha has one as well. Down in that area as well.
And they've been very effective in eliminating these, I guess, unwanted spas.
A question for PD. How do you see this affecting your enforcement? Is this helpful or detrimental in any way? I would think it'd be helpful, but I don't, you know.
Yeah, it's certainly not detrimental. I think it's very helpful because it provides just a really clear regulatory framework for these businesses where we know historically, and I'm never going to paint them all with a broad brush, but we know historically we have seen problems at some of these businesses, and this just makes the rules much clearer for everyone. So I think it's a pretty good common sense proposal.
Exactly what we're trying to go for. Makes it easy for both sides to understand what the rules are for the city, for PD, as well as for applicants as well.
Any comments from the public? Okay. We have motion to open the floor.
Motion to open the floor.
Do I have a second? All in favor?
Aye.
Nays? Ayes have it. Thank you.
Gary Pond, 1474 Finch Lane, Green Bay, 54313. I have some comments that really are associated with for the legal side of this. But before I get there, I just wanted to say, I've been aware that this has been an issue since 2015. I started a petition drive. I have over 600 signatures, and that petition is going to continue until we make sure that we get something resolved. The other thing I'd like to do is, I don't know if any of you have looked at these spas that are in questionable status. One way you do is just Google their telephone number. Don't Google their spa, Google their telephone number. This is a spa on 842 Military. And you can go to it. Only see men, only accept cash. Enjoy an unforgettable time with a new Asian girl. Beautiful pictures of girls. Certainly will submit that as that's appropriate. Now I need to talk about the ordinance. An ordinance is great, but it's got to have teeth in it. It's got to be enforceable. It can't be in conflict with the state Wisconsin 460. Okay? But 460 is pretty broadly. It doesn't narrow it down like this does a little better. But I have some issues. In the state of Wisconsin, it has multiple definitions of a massage therapist. It says if you are going to be unlicensed, then you have to call yourself XYZ. This ordinance only has two definitions: a massage therapy or a bodywork therapist. Okay. I find the definitions confusing. I suggest that we add a definition that's a little more clear. A massage therapist or a bodywork therapist means any person who gives or administers a massage. It should be added there. It's real simple for everybody to understand. Okay? I also found that in the state, you're required to list your social security numbers. I think it's important that we want to know that people that are working in, this ordinance is primarily driven because of illicit activities. So we really want to look for people who are not, maybe they're sex trafficked or what have you. We'll ask for their social security number. It's illegal to hire someone and pay someone in the state, in the federal government, if you don't collect their social security funds. So add that. That needs to be added to section under application contents. Then I found that there are some conflicting statements in here. For example, here's a wiggle room that's in this. You have to have a license. But by virtue of a prearranged arrangement, it says right here, with the applicant, you're allowed to practice.
Gary, would you mind just referring which one you're
Oh,
talking about, just so we know
I'm
which
sorry.
page?
I'm sorry.
Please.
Yes, you do. Okay, first of all, I suggested under 460.03 applicability, I'm talking about defining a massage therapist or bodywork therapist means any person who gives or administers a massage. Under practice requirements, application contents, section 6, parentheses, F, add social security number. Section 6 of F of page 3, if you go to page 3, and if you go to F, it says here, who might be by the virtue of any arrangement with the applicant practice, administer to or offer to practice or administer massage therapy or bodywork therapy at the licensed premises. So, I've heard this, by the way, where they'll come in and they'll say, oh, that's an intern. They'll hide under that. I find that in conflict. It's a loophole. You say, oh, it's just an apprentice. So I'm not in violation. I have a prearranged agreement. So I think that should be stricken. It also comes up again on regulation of operations and licenses, again on page 5, section K. And K is on page 6. To be in conflict with the application contents, again. So if we go to 5 on page 6, it says under K, small k, same language. The licensee should keep records and names and addresses other than those employed by the licensee who by virtue of any arrangement with the licensed practice, administer or offer practice, same loophole language. Again, this gives an illicit operator wiggle room, in my opinion. So I would suggest we strike that. The other thing that is in 460 that is not in here at all is that you're required to get consent. Okay, under 460.11, practice requirements. A license holder may not practice massage therapy or bodywork therapy on a client unless the license holder first obtains the informed consent of the client and has informed the client that he or she may withdraw the consent at any time. That's a state requirement, and it should be embedded in this city ordinance. I have a copy for legal team if it references each of these.
Sorry.
Here. So those are my only comments. Anybody who would like this?
Hi, Leah Weicker, 227 Allard. I am the bid director for Military Avenue. Business improvement districts were created to address blight in areas, and I feel that this ordinance will help extremely in my efforts and our board's efforts to do that. When I first started my job, I went door to door to introduce myself to the businesses, and I got a head shake. And I thought, boy, that doesn't seem like a very legitimate business. And ever since then, I have worked directly with the police department. There was no tooth for them to do much in enforcement. I think like the chief just mentioned, this will give enforcement capabilities and an outline on how they do it. I'm not clear on the fee. Did we determine a fee
Which fee are you
for
talking about?
the license fee?
I think the license fee was $100.
100, okay.
Yep.
And I think that's a fair amount. There are legitimate spas on Military Avenue as well. And they would more than welcome having to pay a fee to be able to get rid of the ones that aren't legitimate and give them a bad name. We did lose one on Military Avenue because of the reputation that it had, and they went to Howard. They are also in other communities, not just Green Bay. The one you're referring to is, that is still Green Bay. Green Bay is on the east side of Velp, all the way, I'm sorry, the east side of Military all the way to Velp is Green Bay. The left side is Howard, from Bond over. But that other spa was in that first mall, which was also Green Bay, and that one is gone. So they move around a lot. They change their names a lot, so you can't always get great records. I think some of our media did a great job in identifying the records that and how many police calls we have addressed. So this will help the city also in reducing police calls. It's a win-win all around. So if there's any issues, I can totally defend them, I'm sure. So just let me know. And special thanks to Melinda. Like you said, I've dealt with several different council people, and it always died for some reason or another. You know, it just wasn't a priority. But it's definitely a priority for our city, I believe. So, thank you.
Next.
Jamie Eber, 1422 14th Avenue, Green Bay, Wisconsin, 54304. I am here because I am a licensed massage therapist. I'm also an educator at NWTC, and I just want to ensure we're all on the same team here. We also struggle with illicit massage, human trafficking, and I know a lot of you were saying that this has been an issue since 2015. This has been an issue since the 70s. So this is not something new to us. And while this is definitely a public safety issue, it's also a therapeutic massage issue in the sense of the people that are that are visiting those places also try to visit us as well. I have gone through the ordinance, and I just want to ensure that this is not going to affect professionals in the sense. So who exactly would need an establishment license would be my first question. So I'm a licensed massage therapist. I practice out of my home, and when I read through this, especially when I look at page 2, and I go into location B, the last states that massage therapy or bodywork therapy should not be performed as a home occupation in a residentially zoned district. While that affects my business, that also affects potential clients who may have accessibility issues. Mobile massage, home and in-home massage is definitely something that a lot of our students and that go out into practice do. So we don't want to have to deny people who are in hospice care massage because we're no longer allowed to go into their homes. I love the gentleman in the back who has gone through the state statutes. There are a few things that I think you interpreted maybe not quite correctly. As far as apprenticeships, you have to be licensed in order to practice massage. There's no wiggle room in that whatsoever. Now, we know that people do practice without being licensed. However, that is not the case. My question would be how many of the places that you have rated have been licensed massage therapists? And my guess is probably not that many, because we do follow state law including informed consent, which we have to have for every single client. We have to have health intake forms, we have to do SOAP notes, we have to do all of these things. And I just want to ensure that my colleagues, my future students, my current students are being protected in the city, because I don't think Green Bay doesn't want massage anymore. I don't think that that's what any of us are saying, but we want to make sure that it is licensed, it's professional, and that we're not being unduly harmed in the ordinance in that process. Because we too want illicit massage gone, but I don't want to lose my business. And part of the reason that I do have an in-home business is because of all of the illicit calls I was receiving. And now I just have to relieve that people. So it's a public safety issue also for the profession.
So that would definitely be a tweak we'd want to make as far as location, because we would not want to inhibit your work from going to people with handicaps and so on. Okay, so that's correct. That's a good.
And then, like I said, I think if we could clarify exactly who needs a massage establishment license. Is it every single licensed massage therapist in the city that would need an establishment license and needs to follow this to the law? Or is it only if you have 2 massage therapists in one area, or if there is a spa that has a massage therapist? So I think if we got maybe a little bit better clarification on that, then perhaps we would have a better understanding and we could come together and figure this out better.
I would think we'd want every massage, I would think. Your opinion on that?
Yeah, I don't have necessarily a problem with that. However, we're already regulated by the state. So to do another regulation on top of licensed massage therapists who aren't causing the problem, it
So
just
maybe
makes it
anyone that's not
difficult.
licensed by the state, perhaps?
You can't practice massage without a license at the state.
Well, then.
I disagree with that. You can. The state allows,
Well-
as long as you don't call yourself a massage therapist.
I think that that's a gross misunderstanding of what the statute is
It
stating.
says it specifically. It says it specifically. You call yourself a Body Works.
1% at a time.
Yep. So,
You can, using the term massage is a licensed thing in the state. So, Randy, I suppose you could say that you're giving massages someplace. How would you do that if you're not licensed?
right.
I guess that's my issue with that. Now, there are certain things, reflexology being one of them. If you are practicing reflexology, you do not have to be licensed through the state. So I think when the state statutes are written, they're specifically stating that type of, there are certain modalities of massage that don't necessarily have to be licensed. However, if you are practicing massage therapy, you have to be licensed. So.
Would you like me to address these specific questions?
Well, let's see if there's anybody else first. Sure.
Can I just say, so the state is, there's a difference between the massage therapist, and then this is specifically relating to massage establishments. So, I mean, I know there's gonna be crossover, but.
So I guess my question is that I practice out of my home, do I need a massage establishment license? And if I do need a massage establishment license, according to this, I no longer can practice in the city limits. If I have a colleague that has rents an office out of a building, and does she need an establishment license? So I guess I'm confused as to what exactly an establishment means.
Can I ask you?
One second. Any other comments?
Did you have anything else?
I guess maybe after I get clarification on that, I will. Thank you.
You want?
I read it, the 460 correctly, I'm not an attorney, but it says that a city cannot pass an ordinance that is in conflict with 460.
Right.
Okay? 460 simply says that if you're a massage, are you a licensed massage therapist? Well, then you don't need an establishment because you're licensed by the state. So you can't pass an ordinance that would infringe on the rights of the state. It says that clearly in there.
Right.
And it says, okay, so she wouldn't need an establishment license because she's already been licensed by the state. Okay, that would add additional burden to her that the state didn't allow for. Okay? The other thing I wanted to say, sort of anecdotally, Appleton was very good at cracking down. I think when they raided 6 establishments, they found virtually every establishment was a house of prostitution. Okay? And they went after that. They also tried to get the landlords involved and ask the landlord before they rent a space for a spa that they make sure that they're licensed before they rent the space to the spa. Now, they didn't make it an ordinance, but they asked for the cooperation of landlords, and they made that public, to do that. If you're going to rent it out, check their license first. So I just wanted to add those things.
Thank you.
Is there anybody else to speak on this?
You want to close the floor? You're done.
Do we need to close the floor in case you'd like to respond to?
It's up to you if you'd like.
We could always open it up
Back
again, I
and forth.
suppose.
Let's just leave it open for now.
Okay.
Sure. Yeah, so addressing some of the questions, I obviously didn't get all of them, but I do appreciate all the comments, so I'll try to answer what I can here. As far as the definitions, we do want those different terms because we're looking at what is defined under the state statute so that we can encompass the proper terms. We are not regulating massage therapists under the Wisconsin State licensure. This is simply for massage establishments, a physical location. So it's the rules regarding the time, the place, the dimensions of the facility that needs to be met in order to qualify for this. So it does not regulate the individual, just the physical location. That's what this ordinance does. And so we do need those different definitions as well. Again, as we pointed out, you do need to be a licensed massage therapist to perform. There's no way around that. If you are performing as a student, there are different rules that apply for that as well. You still have to be under guidance of somebody who has a professional license. As far as the in-home question, the ordinance as it's written right now does prohibit in-home massage therapy as a business. So it's not allowed in residential locations. For who would need a massage establishment license, it's anybody who wants to perform, or who wants to have a physical location that allows for that performance to be there. So someone doesn't have to be a massage therapist in order to open a business like this. It could be a non-massage therapist that opens the business for the massage establishment license. And then anybody that practices in there must be a licensed massage therapist by the state. I hope I'm keeping the different licenses different because one is state, one is local. We're just regulating the physical location, and the time and place and manner type of thing. Those are the questions that I can recall that I wrote down as well.
So for the home one, can we tweak that? I mean, some people work out of their home, they have their office. Would that be then a home establishment would need to create an office and then be licensed? And what about traveling to a client?
But that's not established.
Sorry, I'm just
We're not
adding
regulating the massage therapist, we're regulating the establishment.
Right, well then, so if
No, I'm saying if she were to travel. to
right, so
someone's home, just answering.
if a therapist went to somebody else's home, that's not illegal under our ordinance?
Not under that way, no.
Okay, so that would be permitted, that would be allowed. But to work out of their home, they would need to make an office and be permitted, get licensed.
As we currently have it, you couldn't have it in your home because that would violate the zoning that we have. We wouldn't allow it under residential locations.
No matter
It's a
what?
type of- It's a type of business. Well, that's how it's drafted at this point, yes. So, this is the business, and we're trying to regulate the type of business. We're not regulating the individuals.
Right.
So we're keeping those two separate, but if you are going to operate that, and this is the parameters under which that establishment could function.
Well, that might be something the city wants to look at how, and I remember we were contacted by a group concerned about how the city's ordinance affect in-home businesses. We might need to start looking at how we can tweak our zoning, tweak our ordinances to allow to be more complementary to in-home businesses. But that would be a separate.
Yeah, and I recognize that I have to do a little more research into determine what is allowed under those zoning regulations. This may be a question that's answered in the state statutes as well as in terms of what's allowed for certain locations. It's certainly something I could look into. That's a recommendation. So that's where.
I would make that recommendation. I'd like to address that to see what we can do too, because I think, well, it'd be a discussion to have, a deeper discussion. Do we want to allow more in-home businesses? What kind of in-home businesses do we want? How do we go about that? To me, that's a bigger discussion, and it would include this, but it would include many others as well. So, I don't know if that needs to be separate, or if we could start with this.
Well, Scanlon, I would suggest that be a separate communication.
Yep.
As I mentioned, that's under zoning, so we're talking about any sort of in-home, and if any business in a residential area could potentially be affected. And we have a number of departments and even pending enforcement issues regarding personal businesses in residential areas right now.
Okay.
Is it still open?
Yeah, the floor's still open.
Can
So,
I ask the city attorney's office?
You
about
need,
2 weeks?
I'm sorry, sir, you need to speak directly to the committee.
just talk to us, and
Okay.
it'll redirect.
All right. If you could ask the city attorney to explain that language, it seems to provide a wiggle room. That if the massage therapist says they have a special arrangement with an individual, they're waived from having to have a license. It occurs twice in the ordinance. I just need to, I'm not an attorney, I just want to know why that language is in there.
I'm thinking that it has to do with apprenticeships and so on, but there is a licensed therapist there. I mean, so I think that's where
But it's in conflict with what else is in there that says if you are going to perform this, you have to be a licensed therapist. It's on page 3. No, it's, I'm trying to remember, I'm missing where it was. It says in here, in the current ordinance, that you have to be a licensed massage therapist. Okay, but then in these 2 points that I brought up, it seems to give in conflict with that statement. That, okay, it says that, and you just said it, that you're gonna do massage, you're gonna be a licensed therapist, except if you have a prior arrangement with somebody. So explain that language, why that is in there. That, because if I'm gonna listen, I'm gonna take the girls that I just put up there and say, oh, they're just interns. They're just apprentices.
But there still has to be under a licensed therapist. There still has to be a licensed therapist.
But I thought you said, and I thought you said it, that everybody who gives a massage should be licensed.
They would be over, if someone else is giving that massage, an apprentice, there is a licensed therapist there.
That's wiggle room. That's what my point is.
Well, you need to be able to.
Illicit spas to get around it.
But these establishments don't have licensed therapists.
No, I'm saying it's state law that you cannot practice without a licensed massage therapist there. So for myself, when our students go somewhere, I have to be there because they're actually practicing under my license.
Right. So, I mean, these establishments don't have licensed therapists. So that's how we catch them. They're done then. Because if you have a licensed therapist, then you're learning, you have to be able to learn the trade. You have to be able to have that process. So
I don't think the record says that's the case. There are many establishments that are, listen, they do have a licensed therapist. But they may violate some other.
Oh, it's my understanding that that's generally not the case.
It may not be generally, but it is the case. It has happened. It does happen.
Oh,
So
well,
I think, I'm sorry, go ahead, Logan. I was just going to say really quick, Alder, I think it's important to get back to the point about, this is about the establishment, and the practice of massage therapy is regulated by the state. So if there is an establishment that's licensed, and 10 people there, 5 people have licenses, 5 people don't, that licensure and that issue of practice, actual practicing, is going to be a state issue. It's not going to be our issue. This is establishment. One person is going to apply for this license.
Additionally, the point, sorry.
That's fine, go ahead.
go ahead.
If I, thank you.
Yeah.
I believe the section that the gentleman pointed out, it does not give you an out for not having a licensed massage therapist. The section that the gentleman is referring to is about the information that you need to include for the application. Okay, that doesn't give you the right to not have a licensed massage therapist there. So if you have a third-party virtual of other arrangement, that's separate information. Okay, there's certain things that we can require to be included in the application. That section that you're referring to is the section that all the information that we require for this application. So it's not a way to get out of that requirement. Again, as Attorney Cohart said, that it's regulated at the state level. We're not regulating that. We're regulating just the establishment. So I hope that helped clarify some of the information for the public.
It's not just in that record. It's not just in your application section. It's in the regulation of operations section as well.
I think it's in two sections.
Two sections.
Yes.
Mr. Chair,
Leah?
I think another issue we should maybe look into is reciprocity with other cities. I believe a lot of the people that have been cited already do have license from other states. So I think during the inspections, we need to be aware of exactly how Wisconsin handles that. Because in the past, that's been an issue with people that they had license from Illinois, other areas. It's just another thing that we should know from the police department and when they do inspections.
I'd like to know from the police, how well do you work with, if it's a state issue, do we have any jurisdiction at all then to proceed with any kind of interdiction there, or?
I guess I'd have to look at the statute. My concern is, like, when I check the license, like, run somebody to see if they have warrants, that's a national database. I don't know if I'll be able to access Illinois' database to know that that person is officially licensed in Illinois, or licensed wherever they're licensed, and I honestly don't know the state statute. If it does grant reciprocity, if you're licensed in Illinois, are you allowed? I don't believe so, but I'd have to look into it, that if you're licensed in another state, I don't believe it automatically means you're licensed in Wisconsin. I think you would still have to be.
So state law is you have to be licensed in the state of Wisconsin. It doesn't matter where else. Now, I will tell you that in the upcoming years, they are looking at a compact license, but with that, we would also have to apply for that. It's in the infancies at this point. But there's also a state license lookup. It is state law that every massage therapist who practices has to have their license clearly, whether it's in the waiting room. In mine, it's right on the living room counter, so you can see it. So there is ways that you can look up people as well, and you don't have to have their license number. You can just have a first name, last name, and you can look it up on the license lookup.
With Wisconsin, we're comfortable looking up. To answer the question about reciprocity, I don't know other states to look up other states. Sorry, Siri. With Wisconsin, we could definitely look up, and when we have done our checks, that's the way we do look it up. But other states, we can't, kind of like CCAP is a Wisconsin thing. Illinois doesn't necessarily have it.
But it's a moot point if they're not licensed in our state.
State.
If they, you know, so they're practicing illegal.
I'm a little confused with this whole thing because I believe my understanding that it is DSPS that requires all those license applications to go through and the license comes from there. So wouldn't it just make sense that the establishment makes sure that there needs to be a person, so I'm not a massage therapist, but that there needs to be a person licensed by DSPS, which is our state regulatory body in that establishment. That would make sense to me. Then no one can circumvent that. You know, there has to be a licensed person in there. That's just my suggestion. I mean, a lot of the work that I do in the provisions of my work, everybody has to be licensed by DSPS, which is our Department of Safety and Professional Services.
Shannon, but, sorry, go ahead.
Oh, I just want to clarify,
Oh,
are you
hold on.
pointing to me?
No,
okay.
no.
Behind me, sorry.
Mayor.
Hard to tell. The only reason I bring that up is because several times they've been cited, and that was the excuse I was given, that they were not arrested because they had another state's legitimate license. So I just want the police department to be aware of what those regulations, I'm not claiming to know what they are. I would guess it was Wisconsin because we're in the state of Wisconsin. So we just need to have, what does it look like when we're doing the inspections as the police department? I'm guessing you have to have a Wisconsin license. The 2015 date was just since I've been working on this. I
Was
think
it just you that had stated?
prostitution is as old as the world, is that what the saying is?
Yeah, the dinosaurs.
So until we legalize prostitution, I really do think we have to get this under control.
Thank you. Alder.
Yeah, I was just going to say, so that I'm understanding, or clarifying, that each person in the building that's doing massage therapy has to have a license and it has to be hanging on the wall according to this ordinance. But the question I guess you're having is whether it's not from Wisconsin, it's other.
And I think that question's been answered, that it doesn't matter if you have a licensure in a different state, it still requires the state of Wisconsin. So PD will be able to recognize this comes through the application. This goes through the application process first. There's another section in here that provides that if something changes, you do need to let the clerk know that your application has changed. So if you have new employees, your application would change. You would update that information with the city for your license. So this information would all be current. If you're not current, you're going to fall under some, you're going to run into issues with your license. Potentially could be suspended, could be revoked as well under certain provisions. There's due process for that as well. But recognize that this isn't just, this is an all-encompassing ordinance here. I think it covers a lot of things that we're talking about here. Some of the things that we're talking about are at the state level, we just can't, we don't touch it. So this is what we're trying to accomplish with this ordinance.
The only thing I think I'd like to see is for if someone's disabled, massage therapist going to their home, does that need to be looked at at all? Do we need to include, if someone, if a massage therapist is going to somebody's home, how would that work? Is that an issue with our ordinance? Would that be in violation of our ordinance?
No, I don't believe.
Because we're not really going for the work, we're going for the workplace. You can't have an office in your home with this, but it wouldn't matter at all if you went from house to house.
Well, under that scenario, I still think you need to have a massage establishment license. If you're going from home to home, I believe that may be a different type of practice. I don't want to get too deep into that hypothetical.
Okay, but if they had the license, if we had the city, they had the city license, that'd be good to.
If they have the massage establishment license at the ordinance level, then they would have their own physical location. That's what they would be encompassed by.
Yeah, okay, I get that's what we're doing. I'm just wondering if we need to tweak to allow, I mean, in this.
Again, as has been mentioned before, we're talking about changing zoning codes.
Oh, yeah, it's a separate communication, right, I forgot. My mind skipped, yes.
Yeah, no, it's,
Right, we need to look at that as separate communication. Okay, yep, good.
Okay.
Sorry, my mind's slipped.
Just to clarify, just looking up 460.09, reciprocal license. It does say that the state will recognize out-of-state licenses. You have to just get a statute 440.05 is an affiliated, there's an affiliated credentialing board approval. And once you submit to that, they'll verify, then you're automatically covered with an out-of-state license.
But you would still get a Wisconsin state
You still get-
license in
yeah.
that
No, you
process.
get it, no, you don't. You
I
get it
apologize, you're wrong.
upon application and payment of a fee. The affiliated credentialing board shall grant a massage therapist or body works therapist license to a person who holds a similar license in another state.
Right, they get a
Yes,
license,
exactly.
they get a Wisconsin
But you
license.
have to, yeah, they do allow, they will, you don't have to go and do a test or any of that.
Right, but you've already been tested and you've passed,
Right.
and you didn't get a Wisconsin license. Yep, okay, okay, yeah.
All I was gonna say is, oops, sorry, I didn't mean to interrupt you, but, we're talking about the state level here again, like, again, we don't regulate any of that. The rules are what the rules are, and so this establishment is just for the establishment, this ordinance is just for the establishment. So,
Just a history piece, because I've been working on this for so many years. The cities were never allowed to regulate this in the past. It's fairly recent legislation that came out of Burlington, I want to say, or Berlin, near Milwaukee. And it was Sansevier was the alder, or not the alder, but the state rep that crafted legislation, and it passed the state of Wisconsin to allow the cities to be able to regulate establishments. The entire licensing process is still a state function. So we, as a city, have no regulation to that. So, again, just like in our inspections, I just think we need to be prepared for what we're looking for. What does a state license look like? Where is it supposed to be displayed? Those kind of things. I just hope we prepare ourselves for what does this look like once we pass this awesome legislation or law in the city of Green Bay. And again, I appreciate the efforts.
Thank you.
So this regulates for health stuff and all that. Does the health department get to go in these buildings to inspect if there's a complaint and stuff then? I mean, I assume the police aren't gonna go in to see if it's clean and stuff like that. They would handle a crime or something.
we certainly haven't.
Do we have a city nurse that gets to approve this thing too, or? No?
That was part of that history I just talked about. The county, so first I went to the county to try to find out a way to regulate this. The county is actually banned from regulating any of it. It says like right in there. The city has the ability to do it because of that special legislation that Sanser did maybe 4 or 5 years ago. Our health department, because Green Bay City doesn't have a health department, that is a barrier for us to address health concerns. I think if it was a health concern, we would have to look into what does that look like to send the Brown County Health Department, because they act as our liaison through the city to be a health department. But that's a tricky piece because the county cannot regulate it. Only a city.
Thank you.
To that point, we do have inspections that we're going through for a lot of the issues that may come up and something like that be ancillary to that, so inspection would notice some of the stuff. We also prohibit alcohol sales there as well and food, so some of that safety stuff is taken away from, but not being allowed overall. But yes, there is still a mechanism to ensure that the facilities are safe and functional.
And really, when we were discussing the ordinance, we were talking about, extra burden on the GBPD. And really, and it probably sounds bad, I'm like, it's not gonna put the burden as much on them, more on inspectors, which obviously they have a lot to do too, but if I'm understanding correctly, it's more about inspections, making sure that they're meeting those requirements of the license rather than sending the police in there to do that. Make sense?
It would become a nuisance property as a consequence, correct? That's,
Yes, absolutely, if they aren't keeping up. There'd also be a nuisance property if they don't have the massage establishment license.
Right.
So right out of the gate, if you don't have any licensed massage therapist, that's going to be an issue.
How does this affect current establishments?
Could you say that again?
How does this affect current establishments?
My understanding from some of the stakeholders is that there wouldn't be much, if any. I understand the in-home may be a different concern, but otherwise, just about all of these massage establishments that we do have would fall under this ordinance. They would be able to get their license, generally speaking. Can't obviously ensure everybody, I don't know everybody's background, but from the physical locations, they would all generally fall within the parameters that already exist.
I mean, are we giving them till January 1st? Is there, you have 90 day, if this passes, is there like a 90-day window? How much time do these establishments have to obtain the license?
They would have, again, that is something that we can amend, but at this point, it would be about 2 months, 60 days. So that is something that's flexible. That's not going to be in the ordinance though itself.
Okay.
When we, if this were to move forward, that's one of the subsections that would dictate when the start period would be.
Okay.
So you won't see that in this actual ordinance because it won't apply a year from now. Right, so
Sure.
any grace period, learning curve period, whatever you want to call it, that can be determined by council as well, but it won't be in the actual ordinance.
Just kind of to piggyback off of what Ms. Grant had said, what about the places that maybe don't have, because a lot of massage therapists are licensed, like independent, they rent a room or something, and they might rent a room not in one of your many exemptions, they might just have a space, but they don't have a waiting room, for example, or they might not have 70 square feet, I can't find where exactly
Yep.
all of that is. So are you saying that they are going to have to leave their space and move to a different location so that it does meet all of that, or will they be exempt?
For the requirements that they would need to have, they would need to meet those requirements. As 70 square feet is a 7 by 10 room, that would be awfully small.
And I guess that's less of my issue, more so the fact that they need to have a waiting room.
Yes, so I mean, we're talking about protecting the public here, so if there are more than one people that would be coming to a facility, I'm not sure how just a one room would satisfy. So
Well, a licensed massage therapist typically is one person and they see one client at a time. There's usually anywhere from 15 to a half hour in between, so a waiting room 9 times out of 10 is just extra space for them. And I understand the protecting the public, but I'm trying to protect the profession. That isn't honestly the issue. We just are kind of stuck in that. So I can think of 3 people off the top of my head that don't have waiting rooms that are now going to have to find a different space. And finding space in Green Bay right now is extremely difficult, especially affordable space, for a profession that sometimes is either looked at as sex worker or as a luxury. So we're putting undue burden on the people that are not the problem. And I really have to stress that enough, because it's not licensed massage therapists that are creating these illegal establishments. It's people that just want to use our profession in the process. So I'm just really trying to advocate for everybody in that, so.
I certainly appreciate that. That's exactly what the public comment section is for. So I do appreciate that.
To kind of go off, is there a reason that is in there? Has there been, studies done that if there's a waiting, is it a privacy thing, is it a safety thing? I know you said for public safety, but like Jamie mentioned, if there's a 30-minute gap, I mean, they have to switch the sheets over, they have to do stuff in between, that very rarely there is people in there at the same time as far as the waiting room goes. Or could we put an amendment in if there is, as long as you allow a 30-minute in between appointments, a waiting room is not needed, or something that works with those smaller spaces to accommodate the safety aspect of it? Or is there something else we're trying to avoid?
Yeah, and I know we're just kind of talking on the cuff here a little bit, but something like that, we want to think about enforcement as well. So if we're going to say every 30 minutes, and I don't know if that's really something that we can have our inspectors really enforce. So We would want to stick with rules and regulations that we know we can enforce. Again, the waiting area is just a separate space, so I'm not really sure. I understand that you are in the profession, you understand that as well, but we're talking minimum requirements here about having just an extra space that's not the loop. And then we're talking about the physical location as well. We're not regulating anything else. So just minimum requirements here as far as what this one is requiring.
Question for you, what kind of locations are those?
I'm thinking of one off the top of my head. There's one, it's an office building, so they rent one office room, and that is their massage room.
But if it's an office building, wouldn't there be a waiting room in that building?
It would be their waiting room, and that's what it specifically states, that their waiting room.
So a waiting room?
So a hallway is acceptable? I think that's what I'm saying, like, that's what we need to clarify, because I know you think like it's just a little space, but if you've been in one space and you're paying $400, now you need to get a waiting room, now we're looking at, let's say, $700. It's not a little big, it's not a little deal for the people that have to move now.
But if you change it to a waiting room, there's obviously a waiting room in that facility with that.
And look, that's what the ordinance says. It just says that there's license shall provide a waiting area. If there's something in there, like lease contract, that would say there's a waiting area.
So is the hallway considered a waiting area? It's got to put a chair in, okay. I'm trying to know so that my colleagues ask, I can give them the answers I think.
And this is from the, I don't know if anybody from inspection is still here, so, but I think that, there's going to be, there's got to be a separate area.
So just outside the room?
Alder Stephen, could I just suggest, just gently, the back and forth here, I think it would be helpful if the alders just take comments and then make suggestions, because having Logan answer legal questions on the spot is, he's been doing that, but I think it sounds like you all are gonna want some changes. So let's just get to the, the sort of list of those, and then I would suggest referring back to staff if you want to see some changes, just because a number of people in the audience here have talked 4 or 5 times back and forth.
Well, I had a question, and now that I got that answer, I don't think I need to make any changes.
Okay, and that's fine, I just want to say that just because it's hard, it's gonna be hard for us to keep track.
Yep.
I also feel like we've been working on this for a long time too, so all this comment back and forth, I think, is very helpful for tonight.
Yes, and I can appreciate that. I'm just saying, just in terms of track-ins, I just want to be cautious of not trying to solve everyone's problem on the spot.
Right.
It would be appropriate to refer it back with some direction to make those changes.
That'll be the plan, yeah.
I actually personally have a massage person that I go to, and she texts me. I literally wait in my car until she texts me that when you get here, you can come in. So I agree that not always is it an issue of having a waiting room, and perhaps the ordinance could say if there is a waiting room, then this is what it needs to look like.
Do you know with that therapist, though, the building there, is there a waiting room in that facility? No?
It's got several entrances. Now, I don't have any on military, but this one is several entrances with several different businesses in it. And so you walk in, and there would be a little area that you could go, turn this way to go to that business, go straight ahead to go to this other hallway with a bunch of businesses in it. So you could stand in the hallway literally, but I wouldn't call it a waiting room. But again, I think just like taking comments and my car is the waiting room currently.
Right, thank you.
So you want to refer this back and have them look into that?
Motion to close the floor.
Well done, yeah. We all done?
I think we are. Any other comments, last comments? If not?
Motion to close the floor.
All right, do we have a second? Second. All in favor?
Aye.
Nays? Ayes have it. The floor is now closed. Comments?
Do you think we need to have a section of a waiting room staff look at that closer and come back to us, or?
Many of those questions brought up today need to be looked at by staff, not just that one.
What do you think, what other ones? Give staff direction, because I didn't, okay.
Questions, anything like requesting a social security number for somebody licensed, something more to identify the people. Stuff like that should be considered.
Can I comment on that? When you go to get a government-issued ID, you have to provide your social security number and your birth certificate. So you are providing that when you get your government issued ID, you don't need another social security number. That's something that your employer has to do to prove that you're legitimately, a legal citizen. If you provide the government issued ID when you're applying, you're proving you're ready because do you see what I'm saying? You have to provide that when you get your government issued ID. I know that because I've recently had to do it with my, youngest daughter. We had to bring that in and prove it. So you're done doing it, it's already been done.
Yeah, I'd kind of like to fast track this. I don't want staff, if there's something specific, I don't know if there's anything in the conversation that was specific other than perhaps the waiting room that it seems to be maybe a sticking point. I
And
don't
traveling
know.
to,
Well, that'll be a separate communication.
oh, sorry.
Yep. I know, I slid into that too.
Are we okay to approve this without that? Because I don't want to stop current people in the meantime until that gets done.
Well,
Shouldn't
I don't
they
know that
have-
we want to hold this up.
Yeah, but we also don't want to hold our massage therapists up who have been
No,
legal and practicing and doing everything by the rules.
Are you having a question about mobile massages or the in-home? Because that's two
Both.
different things.
Right, well, the mobile,
Probably the
actually
mobile.
both, which would be a separate communication, correct?
Well, we were talking about in-home being a separate communication because it's, home-based
Right.
businesses is a zoning
Right,
zone in
right.
general.
Mobile,
Mobile is more of a question as to clarification whether they fall under ordinance or not.
would they?
Okay,
This is stated, this is stated.
We want to make sure that question is answered, correct? We need to answer that question.
And do you
Okay.
specify, is it for special needs only, or can they go to anybody's home and do it?
Well, I think we should just get some information and bring it back to you. On that point, I would hesitate to go down any sort of clarifications about the need. Because in general, we're just licensed massage therapy versus perhaps unlicensed sexual purpose, whatever. So I don't know we would get too far down the road of like what the actual purpose of the licensed massage therapist being there was for, other than to give a massage under their licensure.
So then, those two things, waiting room and,
So on the mobile establishment, we can provide clarification by council if that's appropriate, if that would make a difference. And then the waiting room, I would suggest it's going to be either remove that requirement or modify it in some way if you don't want to proceed with the waiting room requirement.
could you have a recommendation for that by council? Information on that,
To make a modification?
to make a modification?
Yes. I mean, I think it's largely going to be remove the requirement or modify it in some way to accommodate
Right.
these other
Right.
areas.
If that could be done by council Tuesday, then I would not, then we don't really want to refer back to staff, because then that would come back here, correct?
Yeah, I mean, this is just a recommendation, so if you approve it, we can talk about those things again at council, and you
Okay,
can have
so,
another opportunity to vote on it.
Yep. So then I make a motion,
Can I just want to, so when I'm reading a floor plan of the establishment which details with particularity the rooms in which massage therapy or bodywork therapy will be practiced, the reception area, the restrooms, and any other areas accessible to clientele. It doesn't necessarily, it's saying you have to show the floor plan, and maybe I'm not reading into it enough, but if somebody were to, in their license application, say that they have their clients wait in the car and you text them, then they're kind of indicating where they're waiting, it's like their reception area. I don't know, am I overthinking it? Or underthinking it?
you can figure it out, you
Yeah,
can take
no,
the time.
Yeah,
At this point, it would be a requirement that there be a waiting room
Okay.
of a waiting area, really, a waiting area for patrons.
okay. And then, is this an appropriate time, because I would
but
actually,
Yeah, question
What?
about the hour change?
Yes.
Yeah, we can do that now.
yeah. On page 5, under F1C, no establishment shall be open for business between the hours of 10 PM and 6 AM. I would like it to be 9 PM, because I think 10 PM is too late.
Well, we closed the floor, but we have a professional in the field is shaking her head no, so I make a recommendation, I make a motion to open the floor.
Second.
All in favor?
Aye.
Okay, ayes have it.
Part of the problem is once again, we are regulating licensed massage therapists who aren't causing the problem. So what if you have someone who's gets done with second shift, they want a massage after they get done with work, they come in at 9 and they get done at 10. I mean, it's not my practice, but I know there are people that like to get massage later at night, and they're not necessarily doing something inappropriate. The 6 o'clock, I mean, I've had clients at 5:30 in the morning because they go up, they go to work early or whatever the case, so they want to get their massage in, maybe they go work out, whatever the case is. So I think when we start over-regulating a profession that's really not the issue, I'm just struggling with some of that. I mean,
Well, this is the open hours of the establishment. So when you talk about over-regulating, I appreciate what you're saying, but we're talking about the open hours of a physical establishment. So it's, do you want them to have an open and closing time or not? This is the time that was set based on feedback we got for an opening and a closing time. So that's what we're trying to regulate. So if they're closed, to your point, they can't give a massage if the facility is closed.
but most licensed massage therapists are by appointment. And I'm not thinking of like the big spas, I'm thinking of the individual person that has an LLC that's not doing anything wrong and is having to have a waiting room, and now they can't practice between 6 and 10, or 10 and 6, and all of these other additional things that they can't have lights according to this. You can't have, like, color therapy is a thing. Sometimes we'll put lights under our massage tables to get different colors. So like maybe it's blue today, maybe it's red, whatever the case is. Well, now according to this, we can't do that either. We're not the problem. And I just feel like this is way over regulation considering we're already regulated by the state. And now I can't practice out of my home. So what am I gonna do with my clients for the rest of the week? Do you know what I'm saying? Like,
Right.
I'm not doing anything wrong. I've never done anything wrong. I feel like I'm an upstanding citizen. I've never had any violations. We've been licensed since 2010. Prior to that, we were voluntary certified. I was voluntary certified. I'm board certified. I'm not doing anything wrong. So looking at all of this, and unfortunately I'm the only massage therapist here, which is too bad. Because I think most of them also would say, this is a lot of regulation for something that I'm not the problem in. The illicit massage is. And most massage therapists, we know exactly where all of them are. And we've tried contacting the powers that be, letting them know. I've gotten phone calls, I've gotten text messages of asking inappropriate massage, and we go to the police and nothing happens. So we're not the problem, it's the people that are patronizing those illegal establishments, and then it comes back to us. So I get really passionate because this is my passion, but I don't think it's fair that I can no longer practice because there are 5 illicit massage places on Military, but I, on 1422 14th Avenue, am not causing an issue, and neither are any of my colleagues. So I'm sorry for being so passionate.
No, that's fine, but to be fair, you are in violation of our zoning laws already, and so are many other people who are working out of their homes. That really is a separate issue.
Okay.
This isn't, and that's been an issue we probably should address for quite a while here, that there are people working out of their homes and shouldn't be legally. And that's been going on a long time and flying under the radar. So that really is separate. But as far as lights and hours, now, glad you brought that up. We don't want to overregulate. Is there a reason for that to be in there that would help us curtail illicit massages, I guess I don't want to use illicit activity?
What was the provision on lights? Because I thought lights were required.
Page 6N.
Lighting.
Says lighting and colors other than white shall be prohibited.
Yeah, and I think you're talking about actual therapy lights, so if there's a carvo we could do for that, like a red light therapy or something. I think that was referring to like signage, lights in the building.
Well, I think that's
not
also
actual therapy.
stated as well in a different spot.
It said no flashing,
Yeah.
or flashing lights outside.
Right, for the signs, yeah.
Right, and that was more just signs and overall lighting, not an actual light to use for therapy.
Okay.
So, I mean, I think if there's some clarification there, we can make that.
There
Okay.
was something about the
How
lights
do
being
we-
low on the.
Yeah, in the room and
But
on the bed.
how do we
I remember it was
determine
page.
10 PM and 6 AM?
Yeah, so that timeframe was determined by a general consensus of what normal hours were for massage establishments in various areas, including Green Bay. It is a flexible time. I mean, it's more general, but generally speaking, in consultation with different police departments, the later hours are generally where some issues can arise. And so that's just kind of a general, robust take on the general hours of the massage establishments. It's really recognized that there are varying hours across the board because right now there is no regulation on it. So you're going to see a lot of different hours.
You'd almost have to think too, like license hours of operating a liquor establishment.
Right.
There's a lot of great liquor establishments that aren't breaking any rules, but they still have to go by times that the general public is determined as right, or the governing bodies.
Right. But this is somebody's physical therapy, and that may not fit into, an 8 to 5 kind of schedule kind of thing. I hate, because
Well,
I'm not thinking of the
8 to 5.
the therapist here, I'm thinking of the client.
But I think when we say establishment, we're thinking of brick and mortar building.
Well, I mean, it'd be her office.
Well, she's not in a brick and mortar, she's in her house.
Well, but I
We have
mean,
to
say
do-
you have a brick and mortar and you have someone who needs to come in earlier,
That's
come
right.
in later because of their work schedule.
I found, so on page 6, under N, it says, lighting in colors other than white shall be prohibited, such rooms, let's see. The 40-foot, let's see, no less than 40-foot candles as measured at 3 feet above the floor. So it has to be 3 feet above. Is that what you're referring to, the particular one, on page 6, again?
So the reason for that requirement is that is something actually that inspections can actually track. That certain phrase that you see is the technical term of how they determine the amount of lumens that are in the room. So it's a clunky word choice, but it's actually the word that inspection can actually enforce. We have a vague term, again, we're going back to, are we enforcing that, can we enforce that? So this is just making sure that the rules are consistent and actually applicable.
Right. But that doesn't refer to a sign though, correct? That would refer to lighting in the room?
Correct.
The
So we
sign was
would
a
want
separate
to.
issue.
Pardon?
The sign was a separate line.
Right. This is the room, and we would want to again allow for the patient a part of their therapy as being light therapy.
That's separate. I was just pointing out that was what I think she was referring to.
Right, that we should address. Correct?
Light therapy, as Attorney Cochart was saying, is separate from the lighting in the room. Correct?
We just want to make sure the room isn't lit to a certain point.
But maybe
So
just
it's
needs
not
to
fixed.
exclude light
But it could-
therapy. It just maybe a little flip in that.
Deputy?
I think there's a differentiation between
Yeah.
establishment and in this situation, it would be like a live-work unit within a neighborhood, right?
Mhm.
That's a zoning question.
Right.
Because you can do you could do like a live-work with a conditional use permit. You're selling Tupperware, you're doing massages, those home-based businesses, right? Are in R1s, but they're live-work units. They're not like an establishment where you're gonna put a sign on the front of your house. I mean, if you start to do that, in my mind, it's different. That's an establishment with a waiting room and parking and all these things, right? I think there's a way to differentiate what she's talking about with the live-work situation than the establishments through zoning.
So maybe we don't even have to worry, because if we're talking about an establishment like that, a waiting room would be reasonable.
Yeah, when I read this, I'm thinking like establishments, like business districts that are set up for spa services, not these one-offs,
Which would be more of a separate issue, the conditional use permit with people working out of their homes, that's a whole
It'd be
separate.
kind of like if you're cutting hair, maybe. Like, what if you're hairstylist?
You had to bring that up.
Licensed to do that, right? No offense. But, you know, there are certain things where people may come to your home, and that, we regulate that depending on how busy it is and how much traffic's gonna be generated and those types of things. But otherwise, they don't even know they're there, let's be honest, right?
Right, I know, right.
It's not a problem.
Right.
Could I just clarify, did you want the change of the closing hour to 9 PM added to the motion? Or
I think that's the,
withdrawn?
I think for,
I think we should leave it.
but for an establishment, even that's, I mean, like a facility we're talking about, they may have clients that want to come in after second shift, that might need to come in before first shift.
So it's my understanding that we're referring a lot to staff, so to refer to Staff General Ordinance 4-23 for further review on the definition of the section of a waiting room with recommendation of modification or removal, clarification if a mobile massage and home massage locations would fall under this ordinance, lighting to exclude light therapy, and to change the closing hour to 9 PM. Is that kind of
To
the
include
motion?
light therapy.
To include. Do you think that was the appropriate motion that I gathered from
I
this?
think you did a fantastic job there.
Who made the motion and the second?
Me.
Okay.
Do we have a motion to close the floor?
I've got a motion. Oh, yeah, just, let's do a motion to close the floor.
Do we have a second?
Second.
All in favor?
Aye.
Ayes have
Can
it.
I, there was a
And I
clarification.
make a motion to refer to staff, blah, 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 blah.
What I said.
I would just say as the clerk stated.
As the clerk stated. I like blah, 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 blah.
Do we have a second?
Just wait, sorry, second, and then state it.
Yeah, and it doesn't affect the motion, but I did want to clarify, it's not just 5 on Military Avenue. Oh, 5 are in my district, there's others. But I just wanted to clarify that for the record, it's not about 5 locations. It's just that that's in my district, so.
Right, oh yeah, it's for the city.
It's the whole city.
Yeah,
But I'm saying there's not just 5
right,
establishments that
yep.
we're concerned about.
Yep.
All right, thank you.
All right.
We have a second, all in favor?
Aye.
Nays? Ayes have it.
What?
Were you the second? Okay.
Were you? Oh, I thought I was.
You were.
I was.
Oh, Alder Grant.
Sorry.
Alder Grant was, okay, thank you.
Morgan was third.
I thirded it.
Okay. On
So clarification on that, Alder Stevens,
Huh?
because that was referred back, so we're going to take that back. There won't be anything additional for council then. We'll take that back, and as we make changes, probably we'll communicate with all of you and then bring a revised draft back at some point in the future.
Well, could we,
Yeah, that's the date been referred back, so we will work on all of those things and bring a report back when we're able to. But I would suggest in the meantime that we'll have to communicate with all of you as to what you prefer in those changes, or we'll have another revised draft.
right.
Revised draft.
Well, if you could come with recommendations, that would be good. I'd share.
It'll be a
When we have that
revised
discussion.
Okay, because you referred it back, so I'm
Right.
saying we have to work on that.
Right.
This list of items,
Right.
so I don't have a date of return.
It'll come back here. Protection.
It'll come back here.
Yes, sir. Back here.
All right, thank you for the clarification. All right, number 20, consideration of possible action on General Ordinance number 1423, an ordinance regarding abandoned bicycles. In my understanding, this was brought forward by the mayor's office. So staff?
Yeah, so a little background on this. This relates specifically to abandoned bicycles. So if there are any abandoned bicycles out there, we authorize PD, Parks and Rec, and DPW to issue notice of abandonment. And these will be stickers of notices of abandonment to these bicycles. If they remain there after 48 hours, then they can be removed. And then they have to go through a certain holding period, and then they can be disposed of as according with law. That last sentence gives us flexibility in terms of what exactly that looks like. There may be different avenues that we take for different types of bicycles. Some may be completely unusable, some may be usable, so different ways to dispose of certain bicycles. And then just ensuring that bicycles are parked properly. and they're not being attached to any light poles in the city. Much shorter one than last time, so.
I have so many questions. I'm just kidding.
I spoke too soon.
Spoke?
Thank you.
I haven't seen it yet.
I'm on it. Motion to approve.
Motion to approve.
Do I have a second?
Second.
All in favor?
Aye.
Nays? Ayes have it.
It's just a great one.
Does it have in there that, like, if it's chained to a pole, they can cut the lock and take it?
Yeah, if it's affixed in a, if it's obstructing, then yeah, it could be removed. It would be in violation of it would be parking essentially, so, yeah.
Similar to the abandoned car rules. Thank you.
Thank you.
I changed my car to a pole.
Okay, all right, informational liquor violation report, please.
Happy to report there were no violations during this time frame.
Perfect, thank you. Clerk's licensing report.
Yes, thank you. So we have issued 171 of the 172 available liquor licenses. We do have one pending that was granted, however not issued. And the clerk's office have been receiving a lot of questions as we are ending the license year. The liquor license runs from July 1st to June 30th. So what happens on July 1st is any liquor license that was not renewed will be going into the available pool of liquor licenses. And how that happens is it goes through this committee, which meets on July 24th. And then they make a recommendation to release any of these into the pool. So starting, and then final approval will happen on council on August 1st, which means as of August 2nd, if we had any that were not renewed, people can start once again applying for available liquor licenses. And my recommendation to anyone who is looking to receive a liquor license is to contact the clerk's office as of a little after July 4th, to verify if we did have any that will be released. And then also to set up an appointment with me to review their application, because the only way we will accept an application is first in time and a complete one. So we wouldn't want anyone who might have not crossed a T or dotted an I to not get that. So please make that appointment with me so we can review the paperwork.
I'll drink to that.
Yes, thank you.
Thank you. Report from the Green Bay PD and Green Bay Fire Department regarding the NOLA zone box discussion.
I believe they
I was gonna pass them out.
Okay, so we're gonna be done here in about 5 minutes, gentlemen?
Did you get these?
No.
Oh, they didn't get them. All right.
You can get one of them, because I gave you two.
Thanks, Jamie.
All right, chiefs, who's gonna go first?
Chiefs.
I guess I'll go first. Well, thank you. Thanks for having us here today. We passed on a little handout that just kind of shows a little background information on the number of overdose that we've had in the community, and then specifically in relation to the number of Narcan or naloxone dosage that have been administered both by police and fire departments. So, in the backside of this, that is also a little background information on Narcan, specific, or naloxone is the more generic name of it, which is providing some little background information on what this is all about. So then, as far as our proposal, or what we're here to inform and to discuss is placing of naloxone rescue kits in City Hall, in our police station, and our fire station, in our Station 1. So these would be accessible, provided free to our community, and then maintained by another source, which is actually someone is in the audience here representing that organization too.
Just, it seems like, I mean, we're focusing on, and I understand why, on the east side, but it looks like the west side is also a big concern.
Sure.
Is there any way we can set up anything on the west side?
Yeah, I think our philosophy is that we start somewhere, right? And certainly all of our police cars and all of our fire apparatus and ambulances have Narcan on them. It's a mobile. This is just a designed to be in a public building, publicly accessible, and and community use.
It's easier to, obviously, we have the authority to say we're going to deploy these in public facilities, but we would certainly encourage businesses in the areas where we see large numbers of overdose incidents to consider whether they might want to install these as well, and I'm sure our guest here can help get them connected if they wish.
Okay, good, yep, thanks.
Are these accessible indoor, outdoor?
They would all be indoor locations.
Okay, so someone is monitoring.
Yes, and
it-
again, they're monitored by the third party. They'll have notices of the door opening and the door closing, and then come back and service them themselves, so. And again, the goal of this is to provide not just the Narcan, but the assistance for steps to recovery, and that's the big part, is this is what we envision as a lifeline to get somebody to that help that they do truly need.
Great, excellent.
Okay.
I apologize for us not calling you guys sooner too. Make have to sit through all that.
That was perfect, thank you. All right, thank you.
gentlemen.
Yep, thanks. Do you need to speak? Do we need to open the floor?
Motion to open the floor.
Motion to open the floor.
Second.
All in favor?
Aye.
Ayes have it.
My name's Christopher Zahn. I'm Community Liaison with Wisconsin Voices for Recovery. We're part of the University of Wisconsin Madison Department of Family Medicine and Community Health. So I'm going to give this, you mind if I step up? When the kind gentlemen were talking about a third party, this is part of one of our program initiatives. And to let you know up front, there is no cost to the city for this. What tends to happen is because you actually own the facilities, a lot of the cities and counties we work with, they prefer that their facilities actually install the box. If they don't want to do it, we install the box too. These boxes are actually censored by us. So the minute it is open, we get a notification that it's open. We get a notification when it's closed. The information is available. Because we work for the university, and part of our memorandum of understanding is that we share that data, and also because of the liability, everyone on our team is a certified naloxone administration trainer. All it is required is that one person in each facility be trained by us, and we're all administration trainers. It's very simple. It is effective. This is harm reduction that saves lives. As you can see, I go everywhere. There is always Narcan in my possession. And we have installed these in over 300 different places in the state of Wisconsin at this time. I'm actually going on the road tomorrow. I'll be gone for the next 3 days because we have such a demand for the naloxone program boxes. It saves lives. This is not going away, and you will see that our adolescents, and it's hitting our younger population. So this is an opportunity to save lives and also provide that information that people can get into recovery. Thank you.
Whoa, question.
Okay.
Have you looked on the west side for a possibility to?
So, that is not up to me. If there is a place you want it, we will install it. If you want it in umpteen locations, then you request that. I am not the naloxone program coordinator. I'm part of the entire program initiatives for Wisconsin Voices. We actually run the emergency department to recovery program. When anybody goes into any of our emergency departments in this area, they are instructed to call a recovery coach and peer support to come in for that opioid or stimulant overdose, so we can do follow-up and try and get that person into services that are required. So there is no limit on the installs. It's wherever you feel is necessary.
Well, it'd have to be a private business on the west side. We don't really have any public.
And, you know, we have been in, and I'll tell you, we install them in hotel lobbies, businesses, restaurants. They are everywhere, gas stations. It's up to the city or that business. If they want it, we will install it.
Okay, well,
Find a location.
yeah, I'll see what I can do on the west side.
Okay. Put it in the house in Dowsman.
Yeah, yeah.
You said you help with rehabilitation services?
So what we do is, let's say somebody comes into your emergency department. If we actually fund programs, so we fund local organizations that have recovery coaches, certified peer specialists. A lot of our emergency departments know that when they come in, they will, not only will the medical professionals be there, but then they will call one of our organizations to come in and talk with that person, offer them services, what resources are in the community. And even if they don't, then we also pay, I mean, this is paid work. This is not free. We pay these people then to make up follow-up calls. And there's no time frame on this. We pay them continuously, these organizations, to pay their workers. So I was actually telling the chief today, we've gotten, one of our main referral sources that is growing is down in the southern sector from the fire department. They are referring people to the program. You know, so it opens up that door for that dialogue for people to get help that they need.
And I guess the question for the chiefs, is this something we're doing in our city? Because this saddens me at the same time, because I feel like we're putting a Band-Aid on the problem if we're not taking further steps to do something else. And and it's a conversation we can always have on the side too, but I know we've talked that we know drugs are an issue, all different ones, but I hope that's something maybe as a city we can take steps further on top of this. And if we have, you know, nonprofits that are willing to work with us, that we are using those resources as much as possible.
Yeah, I mean, with the changes that we have seen in the legal drug trade in the last several years between fentanyl and synthetic opioids and P2P methamphetamine, both of those things have changed everything we know about how to address illegal drug use. And now we're just trying to do things like this to keep people from dying before they can reach that point where whatever it takes for them to turn the corner and get help. So it has gotten that bad. That unfortunately, this is necessary. I wouldn't call it a Band-Aid, I would call it more of a tourniquet.
Okay.
And I guess I gotta say that this isn't just for drug abuse people. Innocent people with the sophisticated drugs can die from the fentanyls and all these things. You might not even know you've been in contact with it. So this is a no-brainer to have this stuff available anyway.
And I can't give specifics, but you're absolutely right, Ms. Morgan. It is not anybody that has substance use disorder. Fentanyl has been found in products that people take to help for other medical conditions. So, for a lack of a better way to say it, fentanyl is cheap to produce, it's highly addictive, and it is effective, and the cartels know that. And they market it in that way, and they brand it in that way.
Okay, thank you.
Thank you.
Motion to
Can I
close
ask
the
one
floor.
question?
Good question for,
Yeah, I have a question for him. Is this something that, is that okay? Sure. Does somebody have to be trained in how to use it? And if it's in a specific location, somebody first of all has to know that it's there and has to know how to use it. So how does that work?
So what actually happens, we want to make this as accessible as possible. And I mean, we work for the University of Wisconsin-Madison. We're part of ultimately the School of Medicine and Public Health. So we have to come up with certain legal requirements. And one of our legal requirements is one person needs to be trained. They have to go through our training. We're all naloxone administration trainers. And there's a lot more laws that I can't speak of. I'm not an attorney, but we have Good Samaritan laws. And honestly, it's the easiest thing to use. Naloxone cannot hurt you. It is safe. It's safe for pets, pregnant women, children. It cannot hurt you. It's an intranasal spray. The way you inject it, it's not like you can go any further up the nostril. It's designed in such a way, and it's a safe thing to administer.
Okay, thank you.
Thank you. Motion to close the floor.
Motion to close the floor.
Second. All in favor?
Aye.
Nays? Ayes have it. Receive and place on file all 3 items.
Motion to receive it and place it on file.
Do I have a second?
Second.
All in favor?
Aye. Motion to adjourn it.
Second. All in favor?
Aye.
Nays? All right, we're now adjourned.
With,
Thank you.
you know, if you could